sharing your story.
All right, thank you, and welcome to another episode of the Unexpected Detour. We are here with the resilience of Black women confronting breast cancer. I am your host, and today we have some amazing women with us. We have Zainab, we have Tequila, and we have her sister Andrea. And we're going to have a nice conversation about toxicity and breast cancer. All right, Zainab, it's your turn.
My turn.
Yeah, you're the one that said you had some questions. What's your questions?
Oh, I was getting into yours first. I didn't know. Okay,
Mm-mm.
so I wanted to know if anyone had been told um, anything specific, or do you think that is there anything specific that you think played a part in you getting breast cancer? Like, for instance, me, I think that vitamin D played a role in mine. When I was diagnosed, my vitamin D was extremely low. My doctor told me that, it could have been, a part of the risk, but my vitamin D was so low. I was put on a prescription vitamin D for a month. I had to take it once a week, and then I had to take it several times after that. Like, it was like different months that I had to do it. So I always thought that that played a part in me getting breast cancer, and also the African grilled lamb that I ate so much. When you're eating these barbecues and it's charred, that charged stuff is cancerous, but I ate a lot of that. So those are the two things that I thought played a part in mine, because I was already into clean beauty. I was watching the products that I used, and I wasn't really around any contaminants and things like that that were carcinogenic. So I thought that that was what played a part in me getting breast cancer. And I want to know if there was anything that you have been told or anything you thought that played a part in yours.
Okay, I'm going to say this. We really don't know what it is, but I know
Yeah,
there is one thing that everybody has done, and we've all drank alcohol.
I don't drink.
I
Well,
don't
I'm
know.
sure back in the day you used to, right?
I've never drank,
Oh,
never.
okay. All right. Well, you gain weight.
Yeah.
That's another one.
Do you
Well,
Obesity.
I
eat
didn't gain
fast
weight until
food?
after.
Okay. You never ate junk food when you were
No, my
younger?
diet was good. No, I didn't gain the weight until after all of this.
Oh, well, then you did good because everybody else I know, they drank alcohol, and alcohol is a big thing
Yeah.
for breast cancer. Your weight gain, especially when you're going through menopause, and I'm over that age, so apparently I should have been small a long time ago, but who listens to the doctor? You think you got the curves and everything, you look good, but hey.
Mhm.
So, and then I know the bottled water. That bottled water.
And plastic.
Yeah, it's the plastic, the straws, no, the plastic straws, the water, whatever it is, it's called what? I wrote it down.
Microplastics.
Yeah, I can't say that word, but it's plastic products. You know what that
Mhm.
BPH or
BPA and
BPA?
microplastics. Yep.
Yes. And then there's another one, PFAS. That's another one.
Yes. PFAS.
That's
Yes. That's in a
yes.
lot of stuff.
Yeah, I'm telling you, I was doing my homework. And then there's another one, PHHS.
Mm-hmm.
Yeah, so all of these things are in things that we use every day and we don't even know it. I
And
went
not just
so
bottled
far
water,
as
like it's in clothes,
yes,
Yeah.
costume jewelry,
yes,
what like it your body is your skin is an organ. So you could
yes.
be, touching something and you can absorb some kind of chemical in your body or, you know, and I would, if you hadn't done a genetics test yet, I would say it could be some kind of external factor that contributed to the breast cancer if you don't have the genetic abnormalities that contribute to it.
Yeah, and Andrea, what you're saying is exactly right. Even if you didn't drink, we wear these clothes,
Mhm.
polyester,
Yes, and
right?
fabrics.
And
You
it's
know, my
in your clothes. Because I've been doing this research, and I'm like, I started doing this research because I knew about the hair dye.
Mm-hmm.
that black hair dye. I didn't know it was attributed to cancer, but I did know from the dermatologist that it seeps into your bloodstream. So he was like, whatever you do not dye your hair. Always use those semi-perms because they wash out.
Is it
Mm-hmm.
just the black dye or all
It's
hair
the
dye?
darker,
No
so
All
dye,
chemicals.
dark color.
Okay.
it's dark. So the darker that you try to attempt to dye your hair, the more toxicity it is in the formula. As long as you do semi and not, like you are reducing your chances of it. But it's for black women of color. It's like the darker it is. So you could do henna, like if you want to do dark, where there's toxic free. But like something that I learned in my process is that we live in an estrogen based world. And
Right.
that is how men are starting to have breast cancer because men typically don't have, estrogen. I mean, at least we think, because some of them, ooh, you think they got estrogen. You know what I'm saying? But
Some of them like estrogen.
you know what I'm saying? Like, but since we live in an estrogen-based world, something that I learned, attributed to mine's, of course, was that I was overweight. And I also had very bad sleep habits. I was notorious for being like that corporate person. So I only slept like 4 to 5 hours a day. And I worked like 14-hour days on most of the days, most of the
Wow.
weeks. So I was notorious. I was like Zainab, my vitamin D levels were very low. I was having bad period issues due to fibroids, and my doctor put me on birth control for like a month or whatnot. And that
Remember
birth
I said
control,
that Zainab? Mm-hmm.
that, that birth control had me on the longest period I ever had of my life. You know what I mean? And then the other contributing factor, of course, is the food. We like something people don't think about. The dairy products have a ton of extra estrogen in it, along like with the other things that we know, like meats and all that stuff. But if you grew up anything like me and my sister grew up, cheese, especially cheap cheese,
Mm-hmm.
is a
Fake
government
cheese.
gifted
Oh, that
product.
government
That
cheese
ain't
is the
real cheese.
best stuff.
It's
That
the
was the
best tasting
bomb
cheese.
diggity.
The wrong thing for you. It's so much bad stuff in it. But overall, like we just said, things that I learned about that are super bad is comforters. If you don't buy comforters that are 100% cotton, and making certain that just not the top layer of it is cotton, but that the filler is cotton, because they love these
They
trickery.
had that blend
They'll
fabric
have
where they
that
Yes.
mixed
blended
it with
and
something.
they're cotton. And the problem with those things, though, is something that happened back in the day. Remember, people were perishing in house fires. They started to put flame retardants on our mattresses
Yes.
and our
Mhm.
comforters and all
In
these
the
things.
walls.
And you spend most of your time of your day
In
in
your
bed or at
house.
work. You know what I mean?
Yeah.
Under these comforters and stuff. So for me, I'm like Zaynab. I had started to clean up a lot of the products around me. Like I don't wear toxic makeup. I don't drink out of plastic. But I never was a water bottle girl. I really was never a big drinker. But I like her too. I like grilled meats and things of that nature. Even though I don't even eat a ton of meat, but I do like grilled veggies. Like that's a thing I
Yes.
would die for. So overall, just knowing about the toxic, something else that's really big to me, I don't use regular tissue. I use bamboo tissue because there's so
Yeah.
many perfumes in the tissue and you sticking it right up your poop. So that's another thing for me. That is like I completely changed my cleaning products. Just smelling and stuff now makes me like when I smell people who use Gains and Tides, like it is such a lovely smell, like those commercials say. But now, because of breast cancer, I can't even really even like inhale that
It
stuff without
bothers
feeling
you
like
to
I'm gonna choke.
smell. It
Yeah, it
smells,
really bothers me now. It feels like it's killing me.
oh,
So
okay.
I'm so because they're so but they smell so nice. So I understand why we attracted to them. Like candles from Bath and Body Works. I get why we attracted to them. Like I just bought it. Look, I'm gonna break down and tell the truth. I just bought some Bath and Body Works candles because I couldn't get organic fresh scents
You should
to
have
get
to
my
let me
house.
know. I have a friend. She makes candles.
Yeah, and I do too, but they don't have the
Oh,
get
Yeah.
that food smell out your house like them Bath and
but she
Body Works.
makes it with I think she's using soy.
They do soil and
Soy.
beeswax and
Yeah,
beeswax.
she
That's a
doesn't
big
use beeswax because she's allergic to it.
But
She
you
okay.
know,
found another
it's
way
not
to
just the
make these
candle.
things.
It's that little metal part. A lot of
The
candles
wick.
don't use it.
It's the
No,
wick.
the silver
The
part that the
bottom
wick is
part.
in. Yeah, that's the
Okay.
part when that burn, that
Yep.
releases
The
that
so guess
chemical.
what? I don't typically I sit mine under a candle warmer, a
Mhm.
light, and it just melt the candle to try to reduce that type of an effect of having, those extra toxins. But the other thing I do too, your air in your home. So I keep air filtration systems. I always change my little vent things, but I keep air filters in my house and I try to keep my windows open during the day because of all the things that your house is brushing around. And in a girlfriend of mine, she's in something called the sister study, and they've been following women that are siblings. And at least one of y'all had to have cancer for like the last 15 years, trying to find out how the other sibling got cancer, if they did or didn't, and what habits happened. And one of the big things they noticed with people living in urban areas, that's the dust in their house was cancerous. So those are the things that I know that have attributed for me. Just like I said, it was my weight, my sleep habits, my vitamin D, and then of course the things that I did eat prior to.
Yeah, I
Exactly.
would say my vitamin D is low as well, and I just had my one of my follow-up appointments from my surgery that I just had. Um, and she was telling me that I need to take a vitamin D supplement, and that will help assist in reducing my chances
So,
of recurrence, because my vitamin D is low. So I don't know if it's specifically contributing or specifically contributed to my breast cancer. But I do know mostly because I had the genetic abnormality.
Right.
I think that was why.
Okay. I would ask her to give me a prescription vitamin D because mine was so low. She said, and I told her I was taking a vitamin D because I had all the symptoms of low vitamin D, but she said that she can give me a prescription strength one, and it's so high. You only take it once a week. They give it to you for 1 month, and then like maybe I think 2 or 3 months passed, and I was taking it again. She just gave me a prescription. She said, whenever I get that feeling, just go ahead and get it filled, or I can just call her and, she'll check my levels again.
I
But it
think a
was
lot of Black people have low vitamin D, and that's
most
it.
people,
A
have low
lot of us,
vitamin D.
because we don't
Mhm.
live in an area where you can get sunshine. That's your
most
vitamin
people,
D.
yes. And if you live in a cold area, it says that most people have low vitamin D if you live in a cold area.
Yeah.
Now you know what's
And
funny though
growing
about
up,
that? Oh, go
uh,
ahead.
we from St. Louis, so it's not a lot of sun in St. Louis. It's mostly an overcast city.
Even
So
though it's hot.
growing up, it even in the summertime, like you barely got sun. And then for me, not even for me being a house person, that's even worse. So yeah, I can see why, that being in cold areas, because it get cold in St. Louis. I'm not
Now
sure.
what I found to
Oh,
be
that's where
funny
you
about
from,
that,
St. Louis?
Mhm.
we both thought,
I
yeah.
liked it out there when I went.
Oh yeah,
Yeah.
it's great. I always
Because I
tell
went
people
to
it's great
because
to
I went to
visit.
Sweetie Pies, that's what.
Ah! So you know what's so funny talking about listening to what y'all talking about though is that I don't know if you ever saw that there's a study that they did about that so like I live in Florida now. Florida is one of the states that has one of the highest cancer rates, but they have better care. They say like the cancer care is better in the colder places.
Yeah.
Yeah, I
And we
will
have a
attest to
higher
that.
rate of getting it, but we have higher chances of getting it because of people getting skin cancers.
Right,
Those
because
those
everybody's sitting
UV
out there
rays.
in the sun and no sunblock, no nothing.
Mhm,
And I
mhm,
found a sunblock for Black women,
yeah.
and it works wonders.
Oh, good.
Yeah,
You
I'll
gotta
tell you
share
the
the name
name
of
of it.
that.
I gotta go
Yeah,
get
you
it.
have to share that.
Yeah, you gotta share that because that's
Yeah,
a hard one
okay.
to find, especially it's not like
Exactly.
white casting is weird. Yeah,
No.
some
This
cream
is
is weird.
just for Black women.
Okay.
And my
And like,
my girlfriend's daughter told me about it. She swears by it.
Mm.
And I put it on and no problem. It's not greasy, not anything. So I'm not a sun person because I had sun poison before. So I will not sit out there.
Mm.
But my son keeps telling me your vitamin D is low because you don't get vitamin D like everybody else that's out in the sun. Yeah, because I
Yeah,
stay
but it's really
inside.
not a high concentration of it from the sun.
No,
You get a
because of
lot
the
of vitamin D
ozone
from
layer is
food.
gone. Yeah. And the
Most of your
ozone layer is gone from the sun. So what we used to have as sun, we don't have anymore.
hmm
So
Yeah.
something else I learned too is that, it's funny how we get prescriptions, right? And you know how you go to the doctor and you go, they say, hey, take this script, and then you go to Walgreens and whatnot, and they have the do not take this pill without eating such and such food, right? Something else I definitely think attributed to me is not knowing how to create the balance in which my body was absorbing things at its best,
Yeah.
at its most capacity. And like vitamin D, we talking about, like they claim it's best to have vitamin D3, K2, and then with a healthy fat, whatnot. I learned I was something called B1 deficient, and that I definitely think attributed to even more of an issue for me. And B1 deficiency is a third world country problem. And I have it in a state so much so that my doctor did not believe me. I had to advocate that I had that problem because she didn't believe me. And B1 does not allow your body to process food as energy.
Right.
Everything I ate made me feel like I had the itis. Everything I ate made me feel like I needed to go take a nap. I don't care if I drank a soda
Hmm.
Because
because
you're
it would not
tired.
turn
Yeah.
itself. Yeah, it wouldn't turn
Yeah.
into energy feeling. It made me
Right.
feel like I needed to take a nap. But
Because I
I
have
did
to
not
take that
know.
vitamin D supplements along
Mhm.
with calcium supplements.
Me too. And
Mhm.
so what I
Oh,
did was I bought a liquid form, and I'm
oh,
gonna
okay.
try that so that
Mhm.
because
Of the
it
vitamin D,
absorbs.
right?
hmm
Yeah.
Vitamin D. I bought a vitamin D K2 with calcium plus calcium.
But there's
Mhm.
different calciums too.
Oh no, I didn't know that.
Yeah,
Yeah,
you
I'm
got to
gonna
be
tell
careful
you.
with calcium because it can cause blockage.
There's two
Yes.
different types of calcium. One is
Mhm.
citrate and one is another one.
Yeah, because one can be soluble and the other one is not.
Right. And the other one that's soluble, that's the ones you don't want.
Hmm.
Right.
I gotta look at it. I have it downstairs. I'll send it to you. But I remember my girlfriend, she was like, you need to take some calcium.
So
I
now I have to
knew,
make sure I
but it
take
was
that
the
B1.
wrong one. Yeah, because
Hmm.
our bones are brittle now.
Yeah.
hmm
I don't know if you had treatment, but I had chemo.
No, I didn't have chemo.
And then I take an astrosol. So those things are making your bones like brittle.
hmm
Thank
Mhm.
God,
Yeah,
and then I'm over the age where I'm going through menopause. Well, I'm
I've
doing it.
just
It's
medically
moving
been
in.
medically induced. So I just had a hysterectomy
Well,
due
I'll be
to
praying for you.
the abnormality in my genes
Mm-hmm.
that were associated to ovarian cancer.
Oh, they didn't
And
give you
it's been
anything for that menopause thing, did they?
they told me to take estrogen, so I've been taking estrogen. And then she told me to get the vitamin D with the calcium because of the menopause makes your bone, So, but I was
Right.
already vitamin D in deficient anyway. But yeah, that's so I haven't been taking it yet because I haven't got it yet. But the estrogen seems to be working pretty well.
Okay. What stage breast cancer did you have, if you don't mind me asking?
They classified it as stage 0 because I
Oh,
caught
okay.
it really early.
Oh, so that's good. They had
So,
made you take radiation?
mhm.
Yeah.
I
How many
had
weeks?
4 weeks, I think it was 4 weeks of radiation.
Oh, that's the pits, ain't it?
Oh my God, it was horrible.
You didn't get burnt, did you?
I did. My skin peeled off and everything.
Oh,
I
you
got
had
a whole new
the
layer.
third degree burns, right?
Yeah, I got a whole new layer. Like a whole layer of my skin was like I was peeling it off of me. When I take the bandages off, it was coming off with
Because
the
I
bandage.
know when I had it, and Zainab and I, one day we were talking, and I was like, Zainab, it feels like I'm having a heart attack. And
Mm,
she's the one, she was like, you're not having a heart attack. That's because your skin, it shrunk from the
mm.
radiation. It was
Mhm.
her. And then I didn't know about the cording. It was her that told me that that's what the pain is under there. I was
Yep.
like, oh.
Yeah, you
I
got to
get
do
that.
Yeah,
those exercises and
Her
stretches.
book is good. She has a book.
I heard. Yeah.
Wait, as a matter of fact, yo,
Mhm.
here's the
She
book.
saw it. She just don't. Yeah, when you see that cover, she saw it. She said on my couch.
Oh, and
Lord,
that's the
yeah,
book, that's the book. It's a
Mhm.
good book. It's a good book for reference too.
Yeah,
Okay.
for me with
So
that radiation, I kept having like I could feel the effects of it in my lungs. So like I have to like almost like constantly do those deep inhale
Oh, to
exhales
make sure you
Mhm.
ain't nothing ain't wrong, right?
because I feel like
Yeah.
y'all just said I feel like I got a coffin trapped around my right lung almost like because it's so calcified in the area.
Oh,
Did they
wow.
do a chest X-ray? You good?
Yeah, no, I'm good. I had
Oh,
an MRI because I'm getting ready to do reconstruction.
yeah, I know. On one boob, right?
No, both. I'm getting
Oh,
the other one
both.
to go too.
Oh, you gonna let that
Sequilla,
go? Oh,
I threw
I
those
heard
D's
it.
on it.
I
he
heard
gonna show
it.
you though.
You want me to show?
Yeah,
You
show
got
them
some
the
new
D's.
ones?
She ain't
Uh-huh.
gonna. Yeah, see, look at
All
her.
Oh,
right. Yes.
wow. That's crazy.
Hold on, but let me show you. I gotta stand up. I gotta turn the camera
Yeah, she
around.
couldn't wait to
That
show me
look
them D's. I
good.
was like,
I've been
okay.
waiting to see him.
Hold
Mm-hmm.
on.
She gonna show you.
Yep,
I've
I'm
been
doing the
considering doing the prophylactic, but I don't know. I'm
Oh,
scared.
they
So
gonna
it's
this
close up.
thing,
it's worth
make
it.
sure when you do it, you order this thing right here so they don't come up too high. This thing right here is like pushing them down because remember Tisha was saying hers is up to her neck. And I
Mm-hmm.
Yeah.
learned from that last time. Mine was like that. But this thing is like keeping them down. This is keeping it around. And it's like a little, I'm all compressed up, but
Okay.
I threw
All
some
right.
D's on it.
All
Okay.
right. All right.
She
I
asked
know
me
that's
if she
right.
could
You
show
have
him. I
your,
said, sure, show them. It's just us.
do you
Hey.
have
Right.
your, I don't mean to be vulgar, but do you have your nipples?
No, I had my nipples removed because I had nipple necrosis after I had my
Mm.
mastectomy. There's a chance. I had the nipple sparing one, but my nipple still died on the breast
Oh,
cancer one.
wow.
So I have
Okay.
to remove both and yeah. So
Okay.
Mhm.
I wear the little prosthetic ones,
Uh-huh.
and the 3D nipple tattoo, which
Okay.
real, yeah.
You
Yeah,
had
that's
a,
what my
but
doctor said
you
that
didn't
that was
have
a
a
possibility.
mastectomy, Andrea, did you?
No, but I have the option still to do the
Oh,
mastectomy
because
so that it doesn't come
that's
back.
what Tamika was saying, that she had the option. Yeah.
Mhm.
They'll give you the option, lumpectomy, mastectomy. So
Well, I wish
Yeah.
I would have done mine at first. I had a lumpectomy. Mine was just a little peanut right here on the right side. They did the lumpectomy, but then a year later, I decided to go ahead and get a bilateral mastectomy. Every time I did my breast exams, everything felt like a lump to me. And I was just so paranoid. I said, I cannot live like that. I told my doctor I want to just go ahead and remove them.
she
Yeah.
got her
I've been
D.
considering it. I'm scared though, but I don't know.
It's not bad at all. It's not
So
bad at
it's good you're on here because she can explain exactly how
it's
it's done.
it's
There are more women that come on here, but unfortunately they're not here who've had the double mastectomy.
The
Okay.
hysterectomy is worse. I did not have no issues with me. I stayed in a hospital for 1 day, and that's just, to make sure you're all right. They took care of you like a baby. But the hysterectomy to me was worse because I had that also. Mine was prophylactic. I had my first fibroid ever in my life. And he said my left ovary was enlarged and probably because the fibroid was rubbing against it. But I was more worried about ovarian cancer. And I had this before, 3 months before I was diagnosed with breast cancer. So I
Mm.
decided to go ahead and get the prophylactic hysterectomy. I had to remove everything. In fact, I had the hysterectomy and oophorectomy. So they took away my ovaries,
Hmm.
my fallopian tubes, my cervix, and my uterus.
Yeah, that's what I just had.
Oh, so they
Everything.
removed everything.
Yeah.
Yeah. Took everything
Oh,
out. And how long
total
ago was that?
hysterectomy you had then, right?
So I had my hysterectomy in November of 21, and I was diagnosed 3 months later in 2022, February of
Mm.
stage 1 breast cancer.
Oh, wow. Oh, wow.
And they also said that women who are in menopause have a higher risk of getting breast cancer as well.
You're not
So
in
that's,
menopause, are you, Andrea?
I am.
He's
I was
medically
forced.
induced like me.
It's medically induced. Yeah.
Oh, okay. Oh, so you okay though?
Yeah, she already went through it. Yeah.
Hold on, you said that they said that women who
It just
are in menopause
started.
or are
What
not in menopause.
No, women who are in menopause have a higher risk of getting breast cancer. It raises your risk.
Oh, you talking about for women who haven't had breast cancer?
Yes.
Okay.
Yeah.
I didn't have it. I just went through menopause.
Yeah.
And I was just surprised. Hey,
You
I
know
had
what? It was something.
no idea what was going on. I never felt any lumps, nothing. But I did feel it under here. But I didn't think nothing of it. I said maybe that was from deodorant.
Mm.
That's what I felt. And then I would have this little pimple there. And I remember the doctor said it was another nipple. I was like, another nipple? Ain't no damn nipple. And that's exactly where the breast cancer was. 7
Wow.
o'clock, as they say. It was 7 o'clock. Yep.
Mine was 8 o'clock. And it was like 6 years prior to that where I had the little metal clip put in when I had not a mastectomy, a
A
mammogram.
lumpectomy. Oh,
Mhm.
No, a mammogram, and they found a little suspicious spot, and they gave me a biopsy. It was okay, but they marked that area with the little metal
yeah.
Clip.
The
titanium clip.
titanium
Mhm.
clip.
So years later, when my breast cancer came, it was right there by that clip.
See,
Wow.
that's why I'm
Yeah.
trying to get my other one. So like you asked me, Francis, so my right, I had the mastectomy on. I did a single. And now before I even had breast cancer, I had a suspicious quote unquote something on my left, and they put the titanium clips there. And that came up, but nothing ever came up on the right.
Yep.
And so I got the clips over there, and I'm like, yeah, I don't want this to turn into something. So I'm gonna
Right.
go ahead and do the prophylactic removal and then do reconstruction for both.
Oh, so that's what you're not doing what Tamika said she had what
I
did
am.
Tamika say she
I'm
had the
doing
hip?
it.
Oh, that one?
Yeah.
The
Hmm.
12-hour thing?
Yeah, that's the one I want.
Woo.
Your
Woo.
sister gonna be there with you?
I
I'm
don't know.
leaving
We'll
next
see.
week.
Yeah, I don't
No,
know
I gotta
because
go
I don't
back
know
to
when
work.
I'm even having mine. Yeah.
Oh, okay.
Find out when I'm even. I don't find out. I guess if I'm eligible to actually do it until the week after she leaves. So it won't be for a couple of months.
Oh, okay.
So
You
I
gonna
have
have
time to
somebody
prepare.
to come with you? Mhm.
Yeah, I have time to prepare and all that because I know for me personally, I'm not gonna do it until May at the earliest.
Okay.
Oh,
Yeah,
Okay.
okay.
I have to get prepared for it because I know, what it entails and just work and all that jazz and having my
You
kids because
did
I
your
homeschool my
research
kids.
and all
Yeah.
that stuff.
That's why I want to go this route for myself, just because I noticed how my body has rejected foreign objects in the past with things. So I'm like,
Oh, okay.
maybe not play this game and try to do the jellies or the gummies or whatnot. And not only that, I lost so much weight, so I got enough tummy skin
Right.
to make a couple of boobies. I could give everybody a couple of D's.
Oh,
Oh,
so
you know
that's where
what?
they got to take it from the stomach?
Yeah,
They can take it from wherever.
Oh,
So they
they
took
can.
for mine, this is my third implant. And
Hmm.
Oh.
if I have to get it done again, I'm just done. I don't think I can go flat though. But they took a little bit from my sides. They did the liposuction on my sides just to put over the top because my problem was, them not being even. One was higher, one was lower. So he did a little bit of scraping on this. Wait, yeah, scraping on this side. This one had the capsular contracture. So he did scraping on outside of that, and he just like filled around it to make them even. I'm all compressed out, pre-
Hmm.
compressed up now, but they're very even.
she's
I'm
loving her
That's
satisfied.
boobs
So
now.
you have implants or you have grafting? Did they?
No implants and fat grafting.
Okay. Okay.
yeah.
Hmm.
Is that
Same
what
way
you
these
getting,
girls getting it in
Tequila?
their butt. I got some in my boots, but it's over my implants for evenness.
Oh, okay.
Yeah.
And so Francis, that's what's making me do the other one, because of the fact that you know how with the well, no, you didn't do it. So with the mastectomy, they cut all of your muscle out. You have nothing. So
Oh,
that's why she has to have that fat over it because it's just your skin and the gummy,
Yeah. All my
unless you
thing
have that
is
fat.
is that what they call, I guess a D flap or what they call it?
Deep flap, deep flap.
That's the
That's
D
where it's your
flap.
own skin. Yep. Yep. So,
Oh,
but you have to be eligible. And I've had 4 cesarean sections.
okay.
So I have to make certain that those arteries are still connecting before they can commit me to actually doing something like that.
Oh, okay,
Oh
okay.
yeah. But either way, they can do it from under your butt. They can take the fat on the back of your butt, and like in your inner thighs. They can take the fat from the back of you. They got a few options, as to where they can get that access
Yeah, the
skin.
girl that was one of my X-ray or my radiation techs, she had when I was getting my radiation, she had just came back to work from having her deflap done. And she told me they took hers from her back, like basically her whole torso, and put them up there, and she looked amazing. Like she was curved out, and she showed me a picture of when it was done, and they were even, and they had fullness and was sitting, like they weren't just sitting all the way up, like all the way up. They was just like regular breasts. I was like, oh, okay, that looks
Oh,
good.
so that's why you said you would do that.
Yes, because she's the one that told me that I still had the option. Because I
Okay.
thought once I had the lumpectomy that I wouldn't be able to go back and decide to do the mastectomy. Because my Quilla was telling me that we had talked about it, that could have been a better option for me. Because now without that, now I have to go alternate between mammogram and MRI every 6 months so that they can keep a lookout, because they thought I had it in my right breast just recently. So I had to have a biopsy in my right breast just recently, but it came back benign. So now I have to keep going back and forth getting imaging done,
They do
just
the
to make
3D mammogram though, right?
sure. I
She
don't
was
know
a
what
VA.
kind of mammogram it is,
They
but
doing a
Huh?
regular. They doing a regular schmegula. She was a VA.
Oh, you
yeah,
too?
it's the compression.
You work for the VA too,
No,
Tequila?
I'm a
No, she's
veteran.
in the military. Yeah,
Oh, but they should have all of those up-to-date things.
it
Well, they
depends on
had
where
the
you're
up to
at.
date biopsy. They
Mm.
have an up to date biopsy process, but the mammogram, I'm not sure if they updated the mammogram process, because when I went back the second time for my second mammogram, they were doing it. It was the compression where they push down on your breast to take the
Oh,
imaging. So I don't
And
I
know.
ain't got much to push down on, so I
and I
go,
personally don't even trust that process anymore. Knowing what
Yeah.
I know, I don't even trust that process. Like I'm
see, I
like,
have the
let's not
3D
waste our time.
mammogram. So the 3D
Hmm.
mammogram is taking 9 slices of your breast.
That
Hmm.
that's not an MRI.
Mm-mm.
Mm-mm. No, it's
Mm.
different.
It's a mammogram, but it's 3D and you'll see it going around. You know how like when you take the regular mammogram, you gotta turn this way, that way, and this way. This
Mm.
way, that way is only 2 ways you turn it.
Mm.
And that's how they do it. And you'll see the machine that goes around and around, and it's taking 9 slices of each breast. So when you turn this way, it'll take 9 slices that way, and when you turn straight, 9. So it's 18 for each, 18 images. You could actually see it when they're doing it because they couldn't
Mhm.
find the clip for me. And that was the worst mammogram because I was thinking something was wrong. And that tech wasn't saying anything. And I'm like, well, what is going on? She was looking for the clip. That's all she had to say. Because
Mm.
apparently the clip moves
Mm. It
since
Regular
mine
moves.
MRI is
it
something
shrunk.
altogether different.
It shrunk, so it moved.
Mm.
Yeah, but you should ask them if they have the 3D. 3D is awesome. I'm
Okay.
telling you.
Because I know the machine, when they put me in there and they press down, the machine does move like in a half circle kind of way to take the picture. So I don't
Yeah,
know.
because you should only have to do 2 positions with that one.
Yeah, I have
Yeah,
to hold myself like this, and
yeah.
then they do a
And
front
then you
one,
do, then that's the 3D
and that's
one.
it.
That's
Oh,
it.
okay.
It's real quick.
Mm.
It's real,
Well,
and if you look, you could see it. Yeah, you can
they
Oh,
see
got
it.
a new one that you just lay on top of, and it doesn't. You
I
know how the
did that
MRI.
one where you lay
I
down.
hated the MRI.
yeah,
The
that
That one where
MRI
MRI
is
you
was
lay,
horrible. The
horrible.
MRI is
the one
horrible.
that you lay in there, right?
Yes,
Mm-hmm.
Mhm.
Oh, I
so
didn't like that
uncomfortable.
one. You can have
But
that
not
too.
the MRI though. This is a new one. It's not. It's rarely anywhere I think now, but it's kind of like a thermography where it just take a snap. It can actually look through your entire body
And
quickly.
you lay down, right?
You just lay down real quick. It's not like the MRI though. It's quick.
Okay, so then that one I had was the MRI where you put your
Mm,
breath through this
yeah,
thing.
no, that thing is horrible.
Oh,
It's painful.
I was there all day, it seemed like.
Yeah, no, not that one. They got a new one for it. They're supposed
Oh,
to show
so you gotta
getting
tell us
breath.
the name of these new things.
Yeah, that one is not
Or either
everywhere.
you gotta do like I do, go take pictures of the machine when they step out the room.
Mm.
When I
That's
got
what
up
I
from
do.
the when I got up from the breast MRI, I could not move. You know, I got nothing but booty. So I'm laying down, and so it like had my back pressed down on this. Oh my
Mm.
gosh. When I got up, I could not lift my butt. My arms, I couldn't lift anything. They had to lift me up.
Wow.
That's
It
how it
was
was this
bad.
last time I did it too, because I've lost some range of motion from having this mastectomy. And you know, they have you with your arms sitting up like this. Like this is as far as I can just naturally raise my arm without slowly needing assistance for it to stretch. And they got me laying like that for 45 minutes. I just felt like my ribs was on display because I don't have no breast on this side. And they got
Oh,
that beam that sits under your chest. I was just like, this is horrible. So I'm with you. It was like I was frozen. Like my body was in this complete gridlock from being in that position for that long. I'm like, this is horrible. Oh yeah. Ugh. I cannot wait to have this other breast removed because
You
it's
know,
a part of it.
they can go in there and scrape that stuff out. I don't know if you got cording or whatever, but ask them. Do you use the stretch bands?
I didn't never get any of that stuff.
No, hold on. Let me turn the camera this way so you can.
she's gonna show you the stretch bands. There they go.
Nope.
Let me see. I didn't see him.
They on
They
the
hanging
door.
on the door,
So,
On the
sis.
door.
okay,
I know
so
exactly what
I
they are.
can't see him.
it attaches to the door,
I see it.
Oh,
and
look at Tamika, my girl is here.
you
All
see,
right, the
and then
pink
you can,
Oh, okay.
and
fashionista.
then like this, you can do the rowing. That's how
Hi,
I don't have
Tamika.
I don't have that problem.
Okay. Mm-hmm.
Tamika could tell you, Andrea, all about reconstruction.
Mm-hmm.
Okay.
Seriously.
She did the
She's
deflap too.
Where's
here, but
Tamika?
when Tamika
Oh, I see
unmute
everybody else
herself,
now. I was on the wrong screen.
Tamika, you gotta unmute yourself. Tamika could definitely tell you. Oh, she got a story to tell about that.
Yes, ma'am.
Hi, honey. How are you?
I'm doing good. How about yourself?
I'm good. We got Andrea, Tequila's sister, on here. I told her you could explain about that reconstruction thing.
Oh yeah. What she need to know?
Just kind of your
What you want to
experience, because
know?
I had a lumpectomy and I'm considering doing the prophylactic. So I just didn't. I just don't know. I'm kind of nervous about it. I don't know.
Okay. So you had a double mastectomy?
No, I only had a lumpectomy right
You had
now.
a lumpectomy. Okay.
But I'm
Okay.
considering the double mastectomy.
Okay. Well, how should I put this? It's a personal preference with the double mastectomy. Um, And personally, the reason why I did it was for because of the type of breast cancer I had, which is triple negative, and it's more likely to come back in the opposite breast more often than usual. So that's why I decided to do a double mastectomy. Um, it wasn't as it was bad at first when I first saw myself, but as time went on, it wasn't as bad, as I progressed through transition of understanding and, knowing my body on
Mhm.
what happened to me. Because in most people and most of us know that any form of mastectomy, whether it's double or single, is considered an amputation. It's like you've lost a limb. So that is
Mhm.
something that it's not just the physical, it's the mental capability of dealing with that.
Right.
Yeah.
Right.
Yeah. So depending on what you could get implants or you could get one of the flaps. But it's all depending on what will make you feel comfortable on what you decide to do.
Mhm.
Can I ask you a question, Tamika?
Yes.
Um, I think in her, like, I guess her saving grace is, I think she is in a position to where she doesn't have to go through the traumatic phase of not having the breast.
Okay.
If that makes sense. Like, because she's in a position where she can do it as a prophylactic because she only needed a lumpectomy. You
Uh-huh.
know what I'm saying? So I think like that's almost kind of your saving grace, right? Like, and I'm just sharing this because I don't want this to be a private conversation where it's more or less like it's just my opinion. I guess I'm more or less asking because for the
Mm-hmm.
folks like you and Zaynab have already had the surgery. So I think
Mm-hmm.
for her, you know, like I said, her saving grace is that she get to choose how she wants to navigate. And then when she does it, it'll be an overnight process, meaning she won't have to go without any breast.
Oh, so you saying like I can do it at the same time, the removal and the
Oh, it's
implant?
all
But
done. Yes.
it's not the removal part that's the problem. It's the
Mm-hmm.
scars after the
Mm-hmm.
removal.
Mm,
That's where the mental come in of
mm,
seeing yourself, because you're physically you're physically seeing something new, something different that was not there before. And so your mental capability is thinking, sometimes it your mind plays tricks on you, as they would say, where you like, well, did I make the right decision? Should I
yeah.
have did this? Why did I make this decision? Could they have cut it this way? Could they have made it this higher? Could they have made it this lower? And you go through all those different mental and emotional channels when you have a single or double mastectomy, whether it's prophylactic or whether you doing it because after you've had breast cancer.
Hmm. So can I ask
Exactly.
you and Zanab? I wanna know what how both of y'all would answer this question. Um, Especially you, Zanab, since I don't know, Tamika, have you had a hysterectomy?
No, I have not.
Okay. So I guess this will be for Zanab.
Mm.
How is how is your libido after having the removal and then, the new breasts?
Oh my gosh, it's very much intact. It's just that, I'm not with my man. My man is in Africa, so um in the beginning, when I was, hearing all these stories, everybody was telling me, "Oh, you're gonna go through this and that and that and that." I haven't really went through anything in regards to that. Only thing that I had a problem with is the atrophy.
Mm,
So after maybe the first year after my mastectomy, I started noticing this atrophy. When I say atrophy, I mean like I was like a virgin. When you go through that, it's going to close you up like this. You know,
mm,
sex can be painful, and then your clitoris start to disappear. It shrinks because it's taking away our estrogen. Low estrogen is it causes this clitoral atrophy, and it close you up and tighten up everything. So they tried to give me these suppositories. They're estrogen suppositories, but my breast cancer is estrogen receptor positive. So I was like, should I be taking this? They said, yes, it's safe. We give it to a lot of women, who are in menopause and had breast cancer. So I did my own research. It says that women who've had breast cancer should not be taking estrogen suppositories. So they gave me a refill for like 6 months worth. And I just stopped taking it. I did it like 3 times and I can't take it. So she told me, you know what, just use it and rub it on the outside so it can make, oh gosh, this is live. It helps your lips puff back
okay.
up because, and
Brings the life back.
brings the life back and it can open you up, but yeah, no, it haven't changed anything. I haven't experienced like the dryness, the loss of libido. Only thing I'm going through is the atrophy. I don't have any hot sweats, nothing. It haven't really disturbed my sleep. My sleep, when I lose sleep, it's just me having to like sleep on my back now after every surgery, but
Mhm.
no, it's
It-
it's fine. Are you getting the robotic,
For
your
He
hysterectomy?
had it
oh
already.
no,
Oh, that
I
is
already
right.
had it.
Oh,
Yeah, I
shoot.
just had it last month.
You had the robotic?
No, they cut me open.
Oh wow.
Yeah,
Oh wow.
because I had a huge fibroid on my left side. and they told me it was too big to go in laparoscopically.
Mm.
So they had to open me up.
And hers had and became invasive where they expanded outside of her uterus.
Oh yeah, they were coming out and so they thought that I had leiomyoma sarcoma.
Which is another cancer.
Way
It's
that
a rare
it's
cancer.
spreading. It's a rare cancer because the way the fibroids was starting to spread outside of my uterus from the last time they saw when I had my appendix out, and they took imaging then, and so they compared it, and they was like, oh, this is like a fast growth, and because it spread so fast that's what made them think that I had that sarcoma, leiomyoma sarcoma. And so they had to go in and just take everything out and do another biopsy because I had 2 biopsies for that.
Tamika, you made me want to cry when you describing how they do your breast, and then when the mental part is the part.
Yeah, it's the mental part. And I was just about to ask Z and Andrea, did they talk to you guys about Bonafide?
I
The
use that. Use
yeah,
that. It's
the
really good, actually.
yeah, my GYN because of the with triple negative, I
I'm gonna
can't
use
do
it.
anything hormone related. So they was able to talk to me about Bonafide, which doesn't have any form of hormones in it, and it is a vaginal suppository for dryness.
Writing it down.
Andrea, are you triple positive negative too?
I
I'm
got it for you.
PR positive.
Oh,
Yeah,
you like me.
she like me too.
Oh,
And
we
so
have
here's
too
this
much,
is
we have an
Bonafide.
overproduction of those hormones.
I just
Mhm.
have one. I'm
Yes,
just estrogen
that's
receptor
it.
positive.
That's what you
Mhm.
use?
Yes,
This
it's
is
called
Bonafide. This
Bonafide.
is Bonafide. Yeah, I use it too.
Mm-hmm.
Oh, what does it keep you? Oh, it's vaginal
So
moisture.
it will help
Yes.
with what Zainab
The
was talking about.
atrophy.
Mm-hmm.
Girl, when I tell you I had a one point where it felt like my chandelier was trying to fall out my ceiling. If y'all can imagine what that,
Mhm.
and it didn't matter what I did, I couldn't tuck that chandelier back in. And I go on walks and I will be walking with my chandelier hanging out of my ceiling.
Really, they said that could happen. I haven't experienced that or the dryness or anything, but mine is just the atrophy.
And
Mm-hmm.
Okay. Now
and
wait a
then
minute. Let me make sure I understand. When you say atrophy, is it weakness or did it like
It
It's
tightened
It's
up.
tighten up?
closed up
yeah.
like a virgin, and then
Yes.
my clitoris look like a baby's, and then your lips, instead of being puffed out there, like they get thin.
like
Mm.
white people
Mm-hmm.
lips, like white
Like
Mm-hmm.
lady lips,
who's?
Mm-hmm.
like white lady lips.
Mm-hmm. 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 She's
You
speaking
know they
fast.
have a twin
She's
lip. You
speaking
know what I'm saying?
fast. She's speaking fast.
Gorilla.
My
That's
bad,
funny.
guys. Yeah, we
So
on
so
record. My bad.
instead of putting it in me, I started just like rubbing it on the lips. She said just rub it on the lips, and
Mm-hmm.
it's starting to puff back out. But I don't want to use that. Like I said, I did my research, and it said that women who are estrogen receptor positive breast cancer should not be using those inside of them. But I called my gynecologist. She told me what it was, and so I called my oncologist, and she said yes, it's safe for me to use, because they didn't want to give it to me until I talked to her. She said yes, but my oncologist told me yes. But when I get home and researched it, it said no, I should not be using that.
Mhm.
Mm.
The cool thing about
Yeah.
this
Try
Bonafide,
Bonafide. It has nothing in it.
it has
Okay.
nothing. It's literally a hyaluronic acid and a sodium salt mix, and it helps with dryness. Some people
Mm-hmm.
say that they have a scent because
Mm-hmm.
of the dryness. The
Mm-hmm.
atrophy, it actually helps with hot flashes. It
Mm-hmm.
helps with discharge, arousal, orgasm, your lips issue you was talking about. It
Yeah.
does. It literally, and this one is called um Reverie Plus. It does
Mm-hmm.
all of it.
Who?
There are different levels of it.
Reverie Plus.
Yes, a
Plus,
Bonafide. It's the
yes,
Reverie
plus.
Plus. Mhm.
And it is the bomb. Like, I'll try to send a little image though, because they got several different types, so for y'all to be able to try what works for you all. And I put it in there like maybe I put it at night in there before I go to sleep, and I do
Mhm.
it like maybe once every 2 weeks, because I was really like just sandpapery
Mhm.
that
Mhm.
area for a while, and I was like, what in the hell is going on? Because I
Yep.
hadn't connected all of those dots yet. I'm just
Mhm.
trying to live out here and do my little regular stuff. And
Mm-mm.
Right.
only time I was
Mm-mm.
even feeling like I was getting any moisture was when I went to pee. It became like a little girl, little
Mhm.
6-year-old stuff down there. Like, I'm not having no odor, no pheromones, no
Mhm.
nothing. I'm like,
Mhm.
Hmm.
what is going on? Like, is she even alive? And
Mhm.
I noticed, like you said, about the whole sex things, it was like I couldn't even relax in that area.
Mhm.
It does
Mhm.
not relax. So, like Zaynab said, it's like a kid.
Yeah.
Mhm.
So that helps. That definitely helps a lot with
Mhm.
that,
I
because
wonder
it'll get you
if
in
that has
emotion.
something to do with the mastectomy.
It's the estrogen.
Estrogen, low
So
estrogen.
it's
Everything
But I
about it
haven't.
is
right.
But
pertaining to it.
you have ER positive too,
I do.
Yeah.
and you're dry.
Who,
Hell
me?
yeah. I would have that
Oh,
issue. It's not, so I won't call it
I
that
bet. Thank the good
anymore.
Lord, then,
Yeah, I won't call it that anymore. But yeah, because remember now, she said, thank God, I'm so mad at you.
huh?
So, like, well, and you gotta remember, y'all, I went through a double dose of exactly what, see, y'all, the thing about you all is that y'all had breast cancer in some form. And I think Tamika, me and you probably had the worser of the form, because we had, and yeah, Francis too, because we had the chemo, we had the
Yeah,
removal,
I
you
had
know what I mean,
all of
and the
that. Yeah.
surgery, right? Well, the
Mhm.
part that y'all got to remember that I got hit with is I had weight loss surgery. I lost 170
Oh.
pounds in the
Mhm.
process of this. So no
Mhm.
matter what, I would have got hit with some type of atrophy
Mhm.
because I lost
Mhm.
a ton of estrogen out of my
Mhm.
body.
Oh, okay.
And then I turn around and get on Accestamine and Flovat, whatever that other one was, right behind each other. So the
Oh,
weight loss,
esomesitine, right?
yeah, SMS thing. So the weight loss alone had me ended up with perimenopause because I'm
Mhm.
45 almost. Right.
Right.
So I started noticing I was having night sweats and all of the crazy stuff and the things that come with just having chemo. And
Mhm.
then now I'm on this. So I've lost 170 pounds and now I'm on a pill that's sucking the remainder of the estrogen out. So
Mhm.
I'm getting it in double dose, but I'm grateful because I don't really get hit so heavily with hot flashes. Yes, I get them enough to know that they exist. That's about it. Like, it's not a bad thing. I don't have the night sweats anymore. Now I don't have the issue down there anymore, but I had an atrophy. I won't call it the full things he said, but
Mhm.
baby, I
Oh
had an
yeah.
atrophy. It was
So
like I was
The
walking
struggle
in
was the
gravity.
struggle is
Zanab,
real.
Yeah,
Zanab,
it yeah.
did they put you on blockers, hormone
No,
blockers? No.
no, no. Well,
Why
I'm
would
on letrozole. Letrozole.
you want a hormone
What's
blocker,
that?
Sandra?
Uh a aromatase inhibitor to
She takes
block my
letrozole.
To
yeah,
block your estrogen?
yeah.
Letrozole she takes.
So
Okay,
she
because
hasn't even put on one yet.
I have
I
my
had
appointment in two
letrozole.
weeks
Hmm.
to for him to put me on the blockers. He
Mhm.
Which
doesn't tell me
one?
what he didn't tell me which one it. I don't know what
I
it
got
is.
a feeling she gonna end up on tamoxifen. And the reason why I got a feeling she gonna end up on tamoxifen is because she doesn't have her ovaries or anything anymore.
But then they would
Okay.
put her on the other one.
So the other one is the AI.
Esomesitine would be for her.
That's the AI, as they call it, right? The
Yeah,
Artemis inhibitor, right? But that
yeah.
they put us on Artemis inhibitors primarily now because we have our ovaries, blah blah blah. Like, it's supposedly some medical ordeal around it because tamoxifen is supposed to induce more cervical cancers, is what they found. But because she doesn't have that issue, I got a feeling they'll potentially probably start you there, see how that works, and then push you to something else.
But
I got that
tamoxifen is for people who are not in menopause.
over
Right. Right.
correct,
Who are
But
not what?
she's in menopause now.
medically in menopause now, and she doesn't have the risk of cervical cancer anymore
Oh,
because that is
okay.
what tamoxifen does. Tamoxifen increases your risk for cervical cancers
Yeah.
when you under 45 and you not on menopause, but she's
Oh.
both.
Oh,
That's why I
okay.
was
So
gonna
she,
ask. She must be under
mhm.
the age
Yeah, I was
of.
gonna say, yeah, she
Yeah,
was
I'm
under
41.
Yeah, she's 40,
Okay,
she's
then
under
that's why they
45,
gave her the
and now she's
tamoxifen.
medically in menopause, and she no longer has a cervix. And so she's basically evaded the risk that comes with tamoxifen. And you got to think about it like this. Little sis, what you're gonna learn is like you want to take advantage of every step of care because they run out.
Mm-hmm.
So tamoxifen is like the first layer of, well, you've had the lumpectomy. That's the first layer of care. Radiation, second layer of care. Now we're talking about the medical aspect. Tamoxifen will be the first, and then those AIs are the second line. And the word is lines of treatment. That's the word that it technically is called, lines of treatment. Being that you're ER/PR positive, that I believe that tamoxifen
So
gonna end up
nobody
being.
was the HER positive, the human epidural growth positive?
Yeah, I wasn't.
Oh,
No,
see,
you're positive.
No.
so I was ER, PR, and HER positive, so I had the human epidural growth too.
Was it low or high? Was it
It was
low or high?
That's why I had to take Herceptin.
Yeah. Okay, because you're 4. Is that true?
No, I'm stage 2, 2B.
Fantastic.
Yeah,
How
2B.
long away from yours?
And that's been 7 years now.
Girl, shut your
Okay, come on.
face. Come through.
You're almost done
My,
with that
I
pill.
found out when I turned 60, okay? So that'll
Okay.
oh,
tell
well,
you
that
how
was
Oh,
old I am.
good.
wow.
When they say
Mhm.
you got the good cancer, you had the good cancer. You
I
good.
don't know if that's good. I mean, that's what the
That's
GYN said. She was like, I
Listen,
don't know exactly, but I
yeah.
do know that HER, that triple positive
Mm,
is the treatable one. That one
Mhm.
can be treated because they have that immunotherapy for it, which is what I
Mhm.
had
mhm,
to take.
And I've
mhm,
learned that they say that anytime you have ERPR, and in your case it sounds like it's a little different, but they say that anytime you have ERPR with a low level of HER2, that could almost be not eradicated, but it has a better chances. So like my neighbor, she's got the C,
Oh, the grade.
inflammatory,
Oh,
inflammatory. That's what it
okay,
is, the inflammatory one with her too positive.
okay.
And there's a struggle in it for her because she's got a higher grade of of it coming back just because it ended up being a C. Remember, like you just said, you're a B. That C is like
mhm,
the most aggressive of forms or whatnot. But because of that, her too, there's
She should
some
have gotten
drugs.
that immunotherapy that I've had. It was called Herceptin.
She again, remember, what they say, your lines of treatment. She just is introduced. I think that they're on Herceptin now, and it's too much like are you on a pill, Herceptin, or you got to go every
Oh,
so
that
often?
was intravenous.
She is, to
mhm.
her, it's as
Which
bad as
which
chemo.
which immunotherapy you had?
I had that Herceptin.
Okay,
I
okay.
had a whole thing, was it TCHP, Herceptin. So I
Mm,
had Taxol and all the other all the other
mm,
ones along with Herceptin, and I had
And
Herceptin for 18 months.
okay.
mm,
Yeah.
Okay.
So I walked around with a port for all that time.
do you know I still
Mhm.
got mine? I'm
You didn't
scared to
take
take
it
it out.
out?
Mm,
I'm scared to take
Because
it
you're
out.
gonna have surgery though.
Well, I know I'm not gonna take it out right now, but
mhm.
I don't know. It's a mental thing. I've been afraid to take it out. I ain't
Well,
gonna even
that
lie to
nurse
you.
called me up and she was like, you're the only patient I ever had that had that thing in it for 18 months, 20
I
months.
didn't have.
Get
I've
it
had
out.
mine in since 20. I've had mine in since January of 2023.
Oh,
Oh wow.
they took mine out. Because I was like, you
Yeah,
guys,
they took mine out too.
I
Yeah,
couldn't do it no more.
they haven't even offered to take mine out yet, but I do know that I gotta have the surgery. But I've been nervous about taking it out. I ain't even gonna lie.
But it comes, they put you to sleep the same way they put it in. You
Mm,
Oh,
know
I ain't worried about the
that, but you
pain.
know where that's
Pain.
hooked up to, right?
It's mental. Yeah, I know it's hooked up to my heart. I definitely do know it's
Yes.
connected to my heart. Yeah, it ain't
Yeah.
about the pain of it. I ain't gonna even lie, because it don't bother me
Because you
as
got
far
that
as that
little hole
goes.
here, and then the hole there, and then it goes
Hmm.
to your valve in your heart.
mm,
Yep.
mm.
that's
But
hooked to
it was
your heart.
awesome.
Yeah,
I
the
didn't
port
know that.
the
Yeah, I
port
didn't know
is a
that
direct
either.
connect to your heart.
Yes.
It's hooked up to the valve to your
You
heart
literally,
because
Yes.
they do the blood work and everything.
Yes,
you
because it make
literally
it
pump too.
easier.
Yeah.
Yeah, it make it easier for them to, like you said, draw
Yeah,
blood,
they put a
do
little
your
cut right
chemo.
here. It's cut there.
Wow.
And then it
All
goes
that.
here.
So, and what
Mhm.
happens
Right
is,
there.
Zainab, is because you in chemo sometimes, depending on what therapy you're on, like I did chemo for like 6, 7 hours straight.
Mhm.
Because they
Intravenously,
do
your
it one
veins
at
will
a
get weak.
time. That's why. They
Well,
get
and your
Mhm.
veins get too weak. Your veins can't handle
Right.
that length
Your
of.
veins can't handle that.
And,
Mm-mm.
no.
and imagine somebody sitting there next to you in a hazmat suit trying to pump a drug in you that they're in a hazmat suit. Just
Mhm.
imagine what that would be doing to your veins if it had to go through your arm.
Mhm.
It would
And
tear you
they
up.
try your arm at first.
No, never.
Oh,
So
they
what
Mm-mm.
they
just
had
did
to,
Mm-mm.
they
mine.
had to, you had to get it directly through your artery?
That's
Yeah,
where
it
that
goes.
Yeah.
port go.
So the
Yeah,
port's
that's
connected
where
to
the
your
Wow.
heart.
port go.
This
Before you
thing,
start your
listen,
chemo,
this
yeah,
thing is
they
so
do
Yeah,
this
see, she still
first.
got hers in there.
Yeah.
it's so engraved in you. If you don't
Mhm.
grow every 6 weeks, it will grow arteries. It'll grow a mass in itself on it.
Mhm.
So
Because
wait,
you
you said
see,
the people that is administering chemo to
The
you is in
drug
a hazmat suit?
no,
they
Yes,
she's
don't.
giving
because it's
she's
not
giving you a
hazmat. It's the
comparison as to what it's like.
No. But
yes.
what I'm
Oh,
telling you,
yours had a
They're
hazmat
in
suit
a
a
on?
suit
hazmat
because of the
suit.
type of drug that it is, because it's so strong. Just
She
like
Strong.
must
the
have got
Red
the red
Devil,
devil.
like
I
the
had the
Red
red devil.
Devil,
That's what
they
it was.
they come in there with a suit on. Yes, ma'am.
Really?
Wow.
Yes.
Oh,
And
that
sit
red
next to
devil is
you
strong, huh?
and sit next to you and squeeze the drug in.
Mhm.
And they don't come up out that soup
Mhm. Until they
while you
leave up
Wow.
out
sitting.
of there.
They
Mhm.
don't come out that soup.
So they in the room with you that whole time?
Well, no. The red
No.
devil is a concoction of two drugs, and there's just happens
Oh,
to be
Mhm.
one portion of it that's red. And that
oh,
red
okay.
devil,
Mhm.
have you ever seen people who do those alcoholic shots
Yes.
where they doing it had shrimp in it, but Logan ate it. You know how they do those alcoholic shots in those those needles, you know what I'm talking about, that little
Mhm.
gelatin
Yeah,
shot where they
yeah,
squeeze
yeah,
it up.
yeah.
Mhm.
So it's big vials like that. And
Mhm.
they're sitting there with two of them needing
Mhm.
to insert them into you on a clock, like watching the time, and they have to slowly introduce, because
Oh,
if they just go in and ram it in you, it will literally throw your body in a state of I can't even explain. But the drug is so
Mhm.
harsh. It I see how people perish during the process because it's so toxic on
Mhm.
your innards. It's the weirdest thing. Your body feel like you got metal parts inside of you.
so then that's the one, Tamika, that you
Mhm.
said your mouth tastes
Oh, like pennies. It
Yeah,
tastes like
with
you sucking on pennies the whole
the
time.
taste buds gone. Literally, it takes it. I let's see. I had my first one February 28th, and I want to say that was on a Monday. By Wednesday, my taste buds was gone. By
Mm.
Wednesday, my tongue was black, and I didn't know
It
what was
burned
going on
everything
because,
off of
like
your
I
body.
said, it's yeah. They only tell you about the your skin turning color, but they never tell you about your tongue
oh.
turning color.
Your
They
feet
never tell
turn
you about
black,
that.
your hands turn
Yeah,
black.
all of that.
Well,
My
my
Feet,
feet turned
hands,
black
yes.
from the one I took,
Mm,
but I didn't have the red devil.
mhm.
So
yeah, no, that red
Yeah,
devil, you can only have it
yeah.
one
all
time
I
in your
know is
lifetime.
the first treatment, it was like
Mhm.
I was at work for 8 hours.
Yeah.
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 Oh
8 hours
oh
of
yeah.
chemo. I never went to the
Mhm.
Mhm.
bathroom so much in my life. It was a shame.
Mhm.
Because every
And
time they
the
finish,
crazy.
they flush that, then they come back, flush that.
Mhm.
So it was like a whole day at work.
And the crazy
Mhm.
thing is with the chemo, so I remember one time I didn't take one of the pre drugs because they give you so
Mhm.
many pre drugs
They
that
Mhm.
gave
I
you
reckon.
steroids before?
Yeah, they gave you steroids before. That was one of the prep drugs, right? But they give you so many pre drugs,
Mhm.
and now I recognize that half of it you need to be not in your right mind,
Mhm.
because I didn't take one of my pills by accident. I left it sitting on the thing, and the lady didn't sit there and watch me take it like they normally had.
Mhm.
And now, like after I didn't do that, I was able to smell all of those drugs just because of them being put in my port. not because
Mhm.
they were open in the room smelling them. I could smell them entering into my body. Like they literally top all of your senses. And
Mhm.
from that point on, because I didn't take that one drug that I had normally took before, the next time I went, she came into the room and it was like immediately my body, my senses was open to that smell and you become
Mhm.
nauseous. You become
Mhm.
so just, and those drug, all of those prep drugs is to keep you from throwing up, to keep you from getting diarrhea, to
Like
keep you from
Benadryl,
not
I didn't even
passing
know
out.
Benadryl was a when they said we giving you Benadryl, I said Benadryl, and they was like, yeah, it's for the nausea, for allergic reactions, all the different things that you
Mm-hmm.
would think, just Benadryl outside of chemo, but just during chemo, what it does to help you, like you said, keep from vomiting, keep from having an outbreak or rash or something like that. So all those parts of the pre-drugs that you get before you get the actual chemo.
So I
And
should
just
be
to keep you
thankful I
sane.
didn't have those problems.
Just to keep you sane. And
Yeah.
I can honestly tell you, like I if just looking back at the process, I will never glamorize it. It wasn't hard. But knowing the type of, speaking of, considering that this topic today was about toxicity,
Mm-hmm.
knowing like how, just how much, oh, excuse me, how much damage that stuff was doing while trying to
Mm-hmm.
cure you at the same time, and how you
Mm-hmm.
really was in a 50% chance of living and dying from this
Mm-hmm.
medicine, is just different now looking back at it and just seeing how
Wheeler,
strong
at
you are.
least you didn't have my son around you to tell you, hey, Ma,
Mm-hmm.
you know that's mustard gas they giving you.
I
He ain't
know.
far removed. He ain't
Oh.
far removed from it. He is not far,
Mustard
because
gas.
it's so
Well,
crazy. So
it's a
is.
chemo is a derivative of mustard gas. Now, if you think about
Mm.
mustard gas, they were killing people with it.
Mm-hmm.
So that's what
And
Red Devil is.
so
Red
that's
Devil is
what
radiation.
this chemo is. And how they started, they experimented with Puerto Rico, where they went over there and they gave
Mm-hmm.
Ricans the chemo and it killed them. That's
Mm-hmm.
really what they did. So they found out this thing worked. I mean, I know I go to the hospital, but it was a doctor from Memorial Sloan Kettering, and he was experimenting, and it was derived from mustard gas.
So did you know also too, any of you ladies who are on any of the chemo drugs, if you're sexually active, your partner is on chemo drugs.
Yes. Yes.
Really?
Yes. Because I asked my oncologist, because I read that. I asked
So
my
it
Mm-hmm.
goes to
oncologist,
them.
was it safe? And he was like, yeah. I was like, no, no, no. Because you're
Wow.
passing fluids. You're passing fluids between you and your mate. And the fluids
Mm-hmm.
that you're having in you are filled with chemo. So
Thank
of
God
course you're gonna
I wasn't.
pass it
Thank
to your
God.
mate.
I had to worry.
What about if he wear a condom?
But it don't
Now
matter. You
that
want to know why?
part,
No, it still do, because again, your skin. When you on that chemo,
Oh,
yes,
Zaynab, that
yes.
chemo, you haven't been on the intravenously, but I'm sure
Mm-hmm.
Tamika can attest to this. That stuff is everywhere. It become your
You can
hair,
smell it
whatever
on your
but hurt you
skin.
got.
You can smell it in your
You can
hair. You can
smell it.
smell it in your skin.
So
Mm-hmm.
You
yours
can taste it in
smelled,
your
whereas
mouth for
mine
weeks.
didn't smell.
Mm-hmm.
In
I
your
The
didn't.
mouth.
red devil
I
is
didn't
probably like the
smell.
strongest chemo that they
No, ain't no
have,
problem. Ain't no
and
problem.
that's
It's a
why it
fact.
smells.
The
Yeah,
worst
it has a
on the
smell.
market.
Mm-hmm.
It is the worst. It can literally damage your heart 2 years after having it.
Yeah.
And when I say you taste like you sucking on pennies for a week or two after you've had it, you
Mm-hmm.
taste like you're sucking nickels and coins. So it doesn't matter if they have.
Because it tastes tinty, right?
I don't know.
It
It
tastes
tastes like
like metal,
that
metals,
it's like
I
metal
all
off.
believe.
precious metals. Yeah. So even though your partner is strapped up in that way, I didn't even let my children sleep in the bed because I'm radioactive.
Mm-hmm. The skin to
I
skin.
am
Yep.
radioactive with
Mhm.
that is why they have to be in a hazmat suit. That drug is radioactive. Frequent. It's got so much craziness in it. I didn't even let them sleep with me. So no, having protection sexually is only your skin is your largest organ.
And
You
Well, I hope
learned a
I
speaking of
lot of
never
what you
stuff
have to
just
have.
today.
stated, speaking of what you just stated about heart, they just talked about that on GMA. I want to say it was this week or last week for, this month being heart disease, about how chemo does affect the heart, um, years down the line on to keep up on your heart condition to make sure you don't get a condition because it can affect your heart.
Wow.
So that is the thing that is making me question right now, which is why I'm going to go ahead and do the genetic testing because, of course, any person in my situation, Tamika, you wouldn't heard, but I know I probably mentioned it before with my siblings, both having something called a BRIP1. They suggest that we take out our ovaries and our cervix.
Andrea, that's what
So
you said? That
Yeah.
Andrea had hers out, but it was a multitude of reasons why she had to have hers out. But one of the things that's got me on the fence about whether or not I want to do it and is making me go ahead and do the genetic testing, because I mean, come on now, if two of my sisters got it, most people will say, "Oh, I know I got it," right? But it was worth it to me to go ahead and do the test because I don't know if you all know this, but most women who have had breast cancer, who go through whether it be prophylactic or because they had to having their ovaries and cervix removed, end up as stroke victims. Because having your ovaries removed increases your chances of some sort of heart defect because there are it's more than just estrogen that your ovaries is producing. And so I'm actively talking back and forth with my heart oncologist or not oncologist, my cardiologist about
Cardiologist.
what my risk look like because and now with this test, if I end up as BRIP1, like that's one of my things where I'm like, damn, I hope, because my mama chose to not mess with one of their ugly daddies twice. You know what I'm saying? And hopefully I don't have this dang on gene because I would choose to not remove my ovaries or my ovaries because stents run in my daddy's side of the family. Most of them
Right.
all
Well, too, the geneticist also told me that, so what she say, because I have the BRIP1, I would have to have had my ovaries removed by the time I was 45.
I know
So after 45, then it would
it's
have
higher.
increased my
Right.
chance of getting ovarian cancer.
Mm-hmm.
So you going to be what, 44?
Be 45.
Right. Okay. So you might be, you might want to go ahead and do it if
That's
you
why
have the
my
BRIP1.
genetic testing is I just did it today.
Mm-hmm.
That's what I'm trying to find out if I actually have and that was why I needed the documentation from you because coming to find out BRIP1 is a slew of gene tests. It's not just like one BRIP1. It's a certain type of
Right.
BRIP1 that they got to target and test for. So as soon as mine comes back, if they say it's positive, I gotta go ahead and do it. But if they tell me it's negative, oh, your girl's sitting there holding on to these ovaries. I'm holding on to them because I don't want to increase another problem based off of something else. So that's why I'm saying hopefully because hopefully, thankfully that our mama was a hot girl, was a city girl, that maybe I ain't got this problem.
Tamika,
Speaking
I
on,
told them about what you said about the prostate cancer and the
Connection to triple negative. Yeah. And just breast cancer period, but definitely triple negative that prostate cancer is connected to it because of the two different BRCA genes that correlated with both.
So you saying if your father had prostate cancer, you possibly you run the more risk of developing the BRIP1
Well,
gene defect. I mean the
well,
BRCA.
in my situation, it was my grandfather and his brother on my mother's side that had it. So it skipped their children, his son, but it hit me. So it's like it may not necessarily hit the actual child, but it may trickle down later on through the family.
Yeah.
And so any how they say any form of cancer you should always have on your documentation because you just never know the genetics of how it will affect maybe down the line. It may not affect you, but it may affect your children or your children's children down the line. Yeah. Yeah.
learned a lot of stuff
Yes.
today, huh?
Yeah. Yeah.
We talked about the
It
toxicity,
is.
Tamika, what we talked about when I interviewed you, the toxicity. Yeah. And
Ah,
the alcohol and the things that we did to our bodies, you know. And if we could do it all,
Yeah,
if we change everything, you know.
that's I was saying in the interview that I can't correlate this is why I got breast cancer, but I did start thinking back to when we had the COVID outbreak. And I have normally, I guess the biggest I ever was with my son, which was 160 pounds. But when the day that I had my first chemo, they weighed me, I was 180 pounds. I had never been that big. But during the COVID time, I was grieving my brother passing. I had some classmates that passed. I was working from home, eating, drinking, just eating, drinking, eating, drinking. So it was like the depression and the alcohol and the stress all together. And then boom, I end up getting breast cancer.
I think
So,
a lot of us with anxiety and
hmm
stress, that is another factor of cancer, period. Because
yeah, I've seen a
we are
documentary on
stressed
yeah,
that.
out. Yeah.
yeah, because
Mm.
they really do talk about your health and wellness,
Yeah.
especially with alcohol. I had started after cancer, maybe just drinking, red wine here and there. But then recently, just this year, I like to watch GMA when I'm working from home. They was talking about linking alcohol to cancer as a whole, and they was like even with just moderation of alcohol, if you already have had cancer, they just don't recommend it. So I done stopped drinking, which
Yep.
that's, as much as I would like to do it, if it's gonna keep me from just a little bit, keep just a little bit away from me getting cancer, then I just gotta do what I gotta do.
Hmm.
If you got to
Yeah.
change your
And it's a lot of
mindset.
other breast cancer survivors that I know did the same thing. They just said, you know what, I'm just not gonna drink. I'm
They
just
probably stop
it's just
drinking.
one
You
less
probably
thing I
lose
gotta worry
weight.
about.
They start exercising. All those
And
things.
my thing with alcohol is like if you ever look at like prohibition, and
Mhm.
I'm sorry, y'all, I'm kind of a history buff, research nutcase,
It's
all that
okay.
stuff. But with prohibition, how much the way that they literally like process everything, not just liquor, but
Right.
Mhm.
everything. The way that things are
Mhm.
processed and the bottom line being money and about longevity of things.
Mhm.
And you know how a lot of things are either, mass produced and like strawberries. I don't know if you all have ever heard of like the Dirty Dozen and the Clean 15 as far as fruits and veggies and all that jazz.
Mhm. Mhm.
Just think about like all the stuff that they trying to do to get something faster, to make it last longer. You know what I mean? Like liquor has changed. Even when I think about all the things that have changed since COVID, I was thinking about this one day. I was eating some a piece of rolls with my kids, like how different they taste compared to when I was a kid. It like you can't not see unless like me and my sister today we went to a place and we had rice wine. She had got a rice wine. And that had like the most refreshingest taste that I've ever had. And of course, it's got it's a different culture around it. But when we think about all the liquor, the way that they, again, go back to the bottom line about how they do liquor in America, I don't want it if it ain't sat in a barrel for 50 years. You know what I'm saying? Because if it ain't just naturally made itself, I don't want no parts in it anymore because I know what they're doing to try to get it here quick, to make it appear to be aged, to try to make it smell like it's been in a barrel. You know what I mean? All of these synthetic things. Like, so now, like, even when I read labels and I see natural flavors, I'm kind of turned off if I don't know what that natural flavor was. I don't want it because they get to hide so many things within these words and
Hmm.
schematics of things.
Yeah,
So,
because I found out that the natural flavor is
is
actually some kind of animal's butt gland. I don't remember what animal it is,
I
but
read that before.
they
mhm.
use the
They
animal's
get to
butt
hide
gland
so much stuff under
to
that word.
create that
Mhm.
natural flavor.
Look
And
like I always mess with people who smoke cigarettes. I'll be like, y'all out here drinking, smoking this cat piss, because they put cat pee in cigarettes.
Mhm.
Really?
Those
and
cigarettes
they
are
Mhm.
smell
very
like cat pee.
addictive.
I believe that.
People
Wow.
have gotten really, really addicted to those cigarettes.
I know.
Wow.
Whatever is in it, they just can't put it down.
And
Mhm.
it's,
Right.
I don't know if y'all saw a thing too. I know some of us look at each other's stories, but like even the fact that they target Black women with all of these
Mhm.
products, and then we turn around and refiltrate that by being Instagram influencers and all that other jazz and talking about, oh, let me get my, no shade to them at all, but it's just like now I cannot help but to see though. It's like what they say when your glasses is rosy and when they clear, you can't go back.
Right.
Like how you see things and all of these beauty brands and
Yes.
it's like even this hair is
Mhm.
toxic.
Mhm.
This
Mhm.
is toxic.
And
When he get heat
didn't
on
you
it,
just put that up there, Zainab? The
Mhm.
catalog here?
Mhm. Mhm.
that's crazy to me with just
Mhm.
all of the things that just like literally are here that's meant to, I'm not gonna say meant to, but when it is directed towards Black women, I just get a little bit more bothered because we're the biggest consumer of all of these different things, and we don't think about the
Mhm.
longevity of
Yep.
how it's going to later affect us. So, yeah.
That's
Yeah,
And
why
I
we
that's
find
can't,
what
that's
myself,
why
that's
we
what
can't go to
everything.
Walmart and all those little stores no
Mhm.
more.
I find
Yep.
myself in the store for hours because when I'm shopping, I'm looking at the ingredients.
Mhm. Mhm. And
You
that's
know,
not
I'm
just
trying
with,
to figure
like
out
you
what
said,
is in here. What is
with
this?
the beauty stuff. That's even down to the nail polish and the acrylic and all
Mm,
those different things.
And it's
It's
formaldehyde and everything.
yes.
they
Like,
said
why
the
are
hot.
you,
They
Formaldehyde,
even said
formaldehyde.
now it's in the hot oil treatments.
yes, like,
Mhm.
why are you
Mhm.
giving me why are you giving me
Wow,
stuff to
what?
tell people that
So the
I'm living?
oil ain't oil no more? Hot
The
oil
oil,
Uh-uh.
treatments.
oil
Yes,
in
it's
a
No,
long time.
ma'am.
leave-in conditioner,
Vaseline,
hot oil treatments, hair color.
Vaseline is damn jet fuel, some
Yeah.
crap,
No, it's
byproduct of jet fuel.
petroleum. It's
Petroleum,
petroleum.
yeah,
Mhm.
petroleum jelly.
Vaseline
Mhm.
is actually made with
And
petroleum,
we've been slathering this stuff
but
on
it's
our kids.
white
Oh,
petroleum.
that's
The
supposed to
other
clean.
one
My
is
kids used to
yellow.
go to school looking like little
Mhm.
grease monkeys. They could
Mhm.
not go out
It's a
the house
picture.
with a
It's a picture right now on my Instagram, and I say, "Look at me and my sisters looking Vaseline clean," and we was okay.
Yep. I told you I had written some notes there. They were about that Vaseline.
Yes,
what
it's
you got?
sad how much
And it
stuff.
says
But
Vaseline, that petroleum, what was it, mineral oils have been linked to the risk of scrotum cancer.
Mm.
Mm.
Mm,
Mm.
mm,
Mm.
mm, mm.
Mm.
Yep, it's
Look
Hey,
how
cancer
long
of
our
wow.
the
parents been
throat.
using Vaseline on us.
Yes, for
I mean, but you think
years.
about it, me and my sister from St. Louis, one of the first and largest lawsuits was against Johnson and Johnson baby powder from out of St.
Yes.
Louis.
Mm.
Yes.
A woman,
Yes.
and thank God that they had the right type of advocates, the right type of representation, because that lady perished, and
Mm.
they were still fighting in court for them. They family to get that money for years
Mm.
Uh,
against Johnson and
Oh, the
Johnson, and
lady that was using the powder, right?
that made
yeah.
it
Mhm.
big for everybody. That she opened up the door, and everybody came
Mhm.
right on through.
Because my
Yes.
mother used to
Mhm.
tell me, because she was a nurse, and she was like, don't use that powder. It's the talc in there that's
The
makes it.
talcum.
Mhm.
Mhm.
And we put it
Yep.
in
Mhm.
our panties, we put it in our armpits, we put it under our
Mhm.
breasts.
And we
All
was
in your
putting it on
chest.
our pads.
Put
Yeah.
That's
it
what
on
I'm
your
saying. In our
chest.
Yeah.
panties, and
Yep.
under our boobies,
Yep.
all
Putting
types
it
of
on
crap
our
trying to get
chest.
some reprieve.
Yeah.
Putting it
Under
on
your
your
boob.
kids to keep them cool. Could you imagine?
Mhm.
Everything.
And we
Mhm.
didn't even
Even
know.
even those sprays, those what is it? What
The
was that brand?
FDS sprays, not the
That,
FDS.
that and was it I haven't wore past it, so what's that one brand? Mag for the
Oh,
pass, and they have the spray too.
Maxi pads. So,
Yeah, you know that feminine spray in a
yeah,
you
little.
talking about
FDS, right?
Vagisil. Oh no, not
Summer's
Vagisil.
Eve,
Uh,
It's
one by
Vaseline,
Vagisil, and it was
Summer's
another one. It began with the M, but
Oh,
women used to use it.
Lumi, Lumi.
No,
No, that's a new one.
no, that's
Lumi is
newer.
new, but I know what she's talking about. The
Yeah, but
spray. They
those
like to
sprays
keep
are
you
even
cool.
attached to that also.
But they and
Mhm.
those things have like what me and my sister was looking at some products, and I'm glad they starting to get rid of it. But those things have butane oil in them.
Yeah.
Mhm. Mhm.
Mm.
Flame
Mhm.
retardant. But there are some apps though. I don't know if you all are hip to because it's not a lot of stuff that I will buy out of the store no more.
Mhm.
Just
Mhm.
because I know that that's the things that they're trying to produce to the masses. But it's some apps that you all could use, and they will help to, I think, introduce you to those words
Yeah.
of things so that you start to see them more frequently. And the moment you see them, even though I can't pronounce it, oh, I know this word, and I know this is the cover up for polyester. I know this
Well,
is the
that's what they
cover up
said
for
on
sex.
the news. If you can't say it or pronounce
And
it,
you don't
You
then
need
don't
it.
want it.
then
Then,
you
yeah,
you don't need to be bothered
yeah.
with
You
it.
buy
And
it.
that's how I buy things when I'm reading that ingredient. If I can't go through them words and know exactly what it is and what I'm
Mhm.
reading, then no, I'm putting it down. Let me look for a different,
And I
different
think it's
product and see what's in that. You
I
know.
think
Mhm.
it's sad that we finally getting to a point where they like, oh, we finally gonna go ahead and get rid of red dye, but they not gonna do that until 2027.
Well,
And
that's
now
the
they've
Right.
already found
red
another
dye
way to cover it
3.
up. Yeah,
There's
they already
red
found
dye
another way to cover
40
that.
too.
There is a red
Mhm.
dye 40, there's a green, there's a yellow, all a blue,
Mhm.
all of
Yeah.
them are affecting people. Why are we only attacking one color?
I know.
Mhm.
You know,
And it's
so
Mhm.
only in America they're allowing these things because in Europe, our same products that are being sold here, and
They
when it's
have
mhm.
exported
warning
to Europe,
labels.
they don't have it
They
in
don't
there. And
have
I've
them
seen that.
issues.
Yeah,
I
I've
watched
seen that
And
when
the
I was in
American
Italy.
product, the
Huh?
American product that they do have there, if it's the American kind, they have warning labels
hold
next
up.
Yeah.
to those
Mhm.
products.
I watch this documentary often. I follow these people like in other countries, and that's what I'm always interested in is how they live, how they eat, what they, you know what I mean? Those they literally go around in the UK and basically kick in stores like they like the dope
Yep.
patrol, but they for
Mm.
snacks. They
They do. I've
literally
Mm.
coming
seen
in these
that.
stores and repossession. Uncovering, free chips, chips, a whole all the things that got
Reese
preservatives.
cups,
They
everything.
literally
I've
will
seen them.
come and take them out the stores
Mhm.
because they like y'all
Mhm.
ain't supposed to have this. Like in
Right.
Japan, they supposedly they like this lady that I follow. They don't sell food with preservatives in them at all.
Yes.
Yeah, I
Like
went to Japan and I've never seen anything like processed. Like all the foods in their restaurants were like made like from scratch. Everything, even the
Mhm.
ramen, like it was all natural, real ingredients in
And
their
you
food.
didn't get sick, did you?
Even down to the
Mm-mm.
stuff that was in
Mm-mm.
the vending machine. Like they had a mini made that you cannot find in the United States. It was a mini made juice that had real cut up grapes. It was a grape juice and it had
Mm.
real cut up grapes in it. And
that
it
Mhm.
was
was
like the
made from
Fanta soda.
real grape juice.
Like
Mhm.
Fanta make a soda
Mhm.
in the UK is 80% OJ, like 80% oranges.
Mhm.
Wow.
Oranges. In America, I think ours got like a 3%.
Right.
Do you
Oh,
drink
I'm just
soda?
throwing out numbers, but it's that difference, that much of a difference of what's really in it versus what's synthetically trying to get to that flavor.
You drink
I'm
soda,
like, and
Tequila?
huh?
You drink soda?
No, I don't really drink sodas too
Oh,
much.
okay.
Mm.
Nah.
Because I
I
know
don't
I
drink
don't.
sodas. I don't drink the normal sodas. I do drink. I fell in love with Olipop. I don't know if y'all ever heard of Olipop.
I've heard of it.
I
Mhm.
love that soda. Got 5 grams of sugar and all
Mm.
natural ingredients. It's got prebiotics and probiotics in it, so it's good for your gut health.
Mhm.
And the
Mhm.
flavoring is it's actual natural flavorings in it from like so you get like an apple when it has apple juice in it, like
Mhm.
and it's carbonized instead of
What's
like
it called?
the
Olipop good.
yeah,
Mhm.
it's called
Olipop?
Olipop.
Oh, Olipop.
It's
They
really
sell it
good.
in the United States?
Hmm.
Yeah, they've been
Yeah,
they've
you
been
can get it at
sent
Publix, Whole
commercials.
Foods. They mainly
Mhm.
sell them at Whole Foods, but you can get them at
Oh,
Publix. They have them, in different places.
I'm
But
gonna
I
have to
mainly
look. I'm
find
in
them.
New York, so we got different stores, but we do have Whole Foods.
Mhm.
Yeah,
Oh,
they
well, you'll
definitely
find
have
them
them
in
at
any
Whole
of your
Foods.
local stores.
Like
It's a
health food
commercialized
stores is
brand.
mostly where they
Yeah,
at.
they done started doing a lot of commercials for them.
Yeah, it's a
Mhm.
commercialized brand. So for me personally, I do drink like if I drink some soda, it's a more of a just to get that edge, and I'm feeling light. Like I need something to enter my system quickly. But our mother, is kind of a jack of all trades, so she taught me how to make sodas like
Mhm.
Really?
fresh. Yeah, like literally fresh out of a fruit, and it'll have all of the different types of
You
prebiotics
gotta
and
go get you
probiotics.
a little business there, girl. Making soda.
Mhm.
I be so look, I be so booked. I got too many kids. I be so booked and busy with these folks and camp
About
and
you,
this.
Andrew, you can make you some soda.
I ain't doing all that. I'm gonna go to the store and get that Olipop.
Look, and
That
my sister
Olipop
been spoiled,
satisfies me.
and my sister been spoiled. Her like I cook like 3 times a day. Like I'm a cooker. And I teach my kids how to cook because I don't get me wrong, I enjoy going out to eat, but I do it more to bring new experiences home.
Mm-hmm.
You
Right.
know what I'm saying? Of different foods home. I don't really got to go out to eat because I just got love this one place, or I just no. I go to eat to just to kind of sometimes fellowship with folks. Like I spend some time with my sister today. Let's go out here to eat to try this different. But I'm bringing it back home so that I can know how to make it at home. I
So
like
your
that
Mm-hmm.
sister took
home
you to a
food.
Japanese restaurant today, didn't she?
Yeah, I did take her to a Japanese
When she said the rice wine,
Yeah.
my
Yeah, it was
son drinks
good.
that because he goes to Japan a lot. And he
Oh, I
restaurant.
love
loves it there.
Japan.
He does too. He wants to stay there.
Oh
It's
wow.
amazing there. It's so clean. I have never been
That's what
I've
he
been to
said.
several different countries, and I have never been to nowhere I have ever been has been as clean
I
as
help you in a
Japan.
second.
That's what he said. It's clean. He
Mm.
said you can
Every
see the
public
package there.
toilet, there's a bidet in every public toilet,
They don't
or
believe in
every
tissue.
public
I hear.
bathroom. Yeah, they have tissue, but all their toilets are bidets.
I
Mm.
want to get one.
I
Yeah.
mean,
Okay.
and you don't see no trash on the street.
That's what he said. And you
The
can't jaywalk there, he told me.
No, you will go to
You will get
jail
a
or you
yes,
will
that's
die.
what he said. You wanted, yeah,
What?
yeah.
You would die
The
because you will
kid,
get
I
hit.
see the kids. They're walking to the kids. They know how to walk to the store. They go to the store by themselves.
Yeah, but they can't jaywalk.
Because
No,
everything's so close. Like literally they build up. So everything they have is like right next to each other. So you could literally live in an apartment that's connected to the market, that's connected to the jewelry store, that's connected to the shoe store, that's connected to the grocery. You know what I mean?
Mm.
Like
Mm.
everything is like connected, and it's all like bunched together. But that's the Americanized side, the city side. I
mm.
haven't been to the village
Oh,
So
I
side.
that
think he likes this some city he goes to. He
mhm.
likes it there. He loves it.
So
Mm.
that's
So
the
when
good.
we
That's the
went to
thing. That,
Japan, we went to Italy. Italy was pretty clean too.
Or was
Mm.
it? I heard Paris was dirty,
But
like
yeah.
New York.
Italy,
It
when we
it,
went
it
to
is.
Florence,
Paris is just like a New York.
Mm.
Florence
They
was
got their
a
areas, but and there's parts of Italy that's nasty too. They're all over. You
well,
just
like I said, we went to Florence, which was beautiful.
Mm.
We went to Milan, which was beautiful. I mean,
far as
I
national
had a
parks,
good
they're
time. We
actually
went to the winery, which was
Mm.
awesome. I don't drink wine, but I saw the vats, just like you said, you want to see the vats? They had the vats with the dates and everything. It was a nice trip. It
So
was
that's
really
something that I would say to bring come I guess circle back is that having cancer has definitely taught me ain't no guarantee for tomorrow.
right.
That
And
is true.
so like that is the one thing that I've also noticed too, as far as you said, Tamika, about mental health, like suppressing your thoughts, suppressing your feelings, and all of that jazz. Like, I
Mhm.
do think a lot of that stuff contributed to, you
Yeah.
know, and I'm a vocal person, so I'm like, dang, how much suppression was I really doing? But I
Mhm.
know that it's there. But
Mhm.
overall, like I said, just going through what I went through, just like literally every day has me thankful. And like
Mhm.
giving that pain, having that moment of paying homage to all of the things, that has got me to where I am and really taking that time to enjoy being in the moment, especially when, I see our friends that are in these scenarios, and I'm saying friends loosely, but like I've come to care about these people that I just see through the internet that are struggling with the same struggles, but to
Mhm.
see that they are perishing, from such a nasty like situation that I just in my mind sometimes I get so pissed off and just be like, Earth is so damn ghetto. Like, how are we still dealing with cancer, breast cancer in 2025?
And
Like,
you
real
know
talk.
there's a cure.
You
And
know what
that's
I
what he
mean?
Mhm.
said.
Like,
Mhm.
There's a cure out here.
and then not only that, y'all always go back and forth about how, oh, it's either one person saying the earth too overpopulated, the next person saying we ain't having enough babies. How you gonna let Mother Earth perish? And it's women. How you gonna let
right.
Mother Earth? These, you know what I mean? Like, these is young, fruitful women that are passing
Mhm.
away more frequently
Mhm.
now because of this disease. So with that being said, like literally that is like every day actively, proactively, intentionally, I'm just like, what's gonna bring me joy today?
That's
And
why I've
Mhm.
decided not to
practice.
tell myself no.
Yeah.
Like if it's something that even if I don't need it, okay, I'll tell myself no. But if it's something that will bring me joy, that will bring me peace, that will lift my energy, bring me a higher, bring me to a higher vibration, I'm doing it.
Mm-hmm.
I'm gonna do it because I don't want to feel like, I don't want to get to a point in my life where I feel like, man, I didn't live enough of my life to feel satisfied with where I end up, because I didn't have enough experiences coming through this, even with going through what we all have went through. I still, that makes me feel even stronger about it.
Yeah, because now you
Because
got to
you just
step out of
never know.
you're going to step out of your comfort zone.
Yeah.
And you're going to explore new things, do different things, go
Explore
different
life.
places. Yeah.
And take up your whole space. Take up your entire space. Recognize that box that you have yourself in is you mentally that has yourself in that box. You really bigger than it.
And I
This
think
is
that's
up
what
to
it
you.
was, how this cancer, we were suppressing everything,
Mm-hmm.
never letting it out. And we didn't know how to let it out. And Black women, we go through a
Carry
lot.
the world on our shoulders.
Yeah. And
Everything, we carry the
we don't know
world and
how
carry
to.
everybody.
Nobody really wants to listen to us,
Mhm.
because they think, oh, you Black, you strong. No,
Yeah,
we
you
got
strong
we
Black
got issues
woman.
just
Like,
like the
no, I
rest
don't want
of
to be a
everybody.
strong Black woman. I want to chill.
You
What they
you
say,
want to
Big
be
Mama
a
did.
human being who
Right.
has emotions, and somebody
I
gonna
ain't
listen.
trying to
I
be
want to
big, Big
relax.
Mama.
Why I gotta be strong all the
Right.
time?
Because that's
Like,
how society sees us,
Yes.
Yes.
as the
And
Yes.
strong
I
Black
just
woman.
I just came to that because, I don't feel like since I've started this breast cancer journey that I've been living enough. But typically, like Andrea said, I'm like a homebody, and until I get to Africa, whenever I'm here, I'm just in the house. I'm not getting any vitamin D. I rarely go out unless it's a function, and I decline a lot of things, but I really need to get out and live. I just turned 53 2 days ago.
oh,
Mhm.
happy birthday.
Yes, I
Yeah,
just
yeah, yeah, yeah.
yeah, I just turned 53 and I said, you know what, this next chapter of my life, I have to live. And I know that this is a lifelong recovery, but I'm not
Mhm.
going to hold back. It's still more out there that I want to see. I know what I have to do to keep my risk low. And I know the things that I shouldn't be ingesting or using or things that I shouldn't be around. So knowing and having all that knowledge, I know how to go forward to help prolong my life. Listen,
Because when
the
you know
people in
better,
my
you do
family,
better.
exactly.
Yes.
The people in my family live, their 90s, 100. My grandfather,
Mm-hmm.
I was born on his birthday. He lived to be 99. He died a month before his birthday. He wasn't on
Mm.
medication. He was still doing his gardening. I said, listen, that's going to be me. I'm
Yes.
going to live to be 100.
Mhm.
So I'm more than halfway there, but
Mhm.
I just have to just get out and live, and
Yeah.
Mhm.
when I went into hiatus and taking a break from this whole breast cancer thing, it felt like breast cancer was like totally like just
Taking
taking
over
over
your
me.
Taking
life.
So
over, yes.
I
Mhm.
had to get off
Lord.
the social media. I'm not even
Mhm.
supposed to be talking about breast cancer. I'm committed to the 50 event this
Yes.
Saturday. I'm going to come and speak and I'm going to do the podcast, but I had to get off of Instagram. It
Mhm.
was just,
Mhm.
coming up with content and I do a lot of research because, I'm working on my fourth book, but I
Mhm.
just I had to just take a step back.
And
Let me
you know
ask
what's
you
funny
all a
is
question. Before you had breast cancer, how much
Mhm.
research did you really do?
you said how much
I
was what'd you say?
Before you even found out you had breast cancer, or even the word became a part of your everyday living, how much research did you really do on this disease?
Are
Oh,
you
Absolutely.
talking to me?
All of you.
Any of us?
Okay, so
Any
none.
of
for
you.
None.
me,
None. I'm gonna be honest, none. I
Okay.
knew about breast
Because that's a
cancer.
that's an honest
That's
question,
an
an
honest
honest
question,
answer.
and it's an
And
honest
it was none.
answer.
okay,
And when you
None.
got breast cancer,
I knew
you,
about it, but I
right,
didn't know what
you didn't
when.
know about it because we didn't
We
experience
didn't
it.
experience
Right.
it. Yeah.
Literally,
exactly.
when they said I had breast cancer, I didn't know it was different forms of cancer, breast cancer. That was the first
You
thing.
just knew a word, breast cancer.
Right.
That's it. Then the type of breast cancer I had, when they said triple negative, in my mind, oh, it's negative. I'm good. They was
Mhm.
like, no, no. I'm like,
Yeah,
okay,
I
I'm
was a
not
fool.
good. Like, what are we
Right.
talking
They had
about?
to pull you back
What are we
in. Pull
doing?
back. Pull back.
And
Pull
right,
back.
like, what are we talking about? So yeah, you don't know. Even ladies now that I meet, and you ask them, okay, they told you you had breast cancer. Well, what type you had breast cancer? And the first thing they said, well, they just said I had breast cancer. And I'm like, no, it's more to it than that, because now I know. But if I hadn't had breast cancer, I would be thinking the same thing they're thinking. It's just breast cancer. No, it's a form of breast cancer. It's a stage of breast cancer. It's a grade of breast cancer. Because even when they told me grade, I'm like, what you mean grade? What that mean? And then I had to go research what grade mean, other than, because I'm thinking, okay, they say the stage, and then you say you stage 2, okay, I'm good. Then look, I'm back to I'm good. Then they say, well,
Mhm,
no, yeah, you good, but you're not good. Well, what you mean? Like, what are
Mhm.
we talking about?
Right,
So it's
right.
like
Yeah.
you go through, you learn more once you actually go through it. Like you
Right,
said,
that's
it's
why I said before
mhm,
all of this, it
mhm,
was just a word,
mhm,
breast cancer. You knew
mhm,
people, women got it, they died from it, or they
mhm,
survived from it, but you never
mhm,
thought it was going to be you.
I didn't
I
mhm,
was
even know
going to be
that.
the one having to tell your story about
mhm,
it. And the reason why I asked is because I was in that position. I knew
mhm,
that there were stages,
mhm,
but I didn't know it was triple negative, triple positive. I was all over the place. And then the inductal carcinoma and
Yeah.
I
Hep
didn't even
D,
know it was
all of
stages.
these words, they were like, huh?
I
You
didn't
know?
even know
And
it was
for
a
me,
stage 0.
I did so
I
I
much
didn't
didn't
even
either
I
research.
until I
didn't even
had
know
it, and I
that.
was like, "What?"
I thought when you rang the bell, it was done. I had no
Yeah.
clue that that was like a whole damn damn commercial slogan almost. Like I
Exactly.
literally thought when
Right.
you rang the bell, it was a wrap. And when I
You
found
thought
out
that was
that
it, huh?
I
Yeah.
was like,
Well,
this is a joke. Like
I
this is
didn't
right.
get to
like a
ring the
trophy.
bell, so.
I feel like I
I
was a little
didn't
kid
either.
playing soccer,
Don't feel
getting
bad.
a dude showed
No,
up to the
that's
soccer
because where
game.
I went, they have other cancer patients there, so they don't ring the bell.
Mhm,
Because
Mhm.
they don't want somebody who's going through treatment and it's a different type of cancer, seeing you ring this bell and they know what the bell means.
mhm,
That facility of Sloan Kettering, they
mhm,
just didn't do it. But for me, I'm gonna tell you how smart I was. I went to the doctor like I knew everything. I was like, yeah, I know I have stage 2A. And she was like, who told you that? I said, I told me that because I read the report. She was like, you have 2B. I said,
mhm,
I almost broke down in tears because that
mhm,
2B meant it was in the lymph nodes.
Mhm.
See, I didn't know that. So I just knew it was little,
mhm,
a little thing. And I was like, oh, I'm gonna be all right and stuff. And she was like, no.
mhm,
So the grades give indicate where it indicate that the level, like the intensity of the cancer, like
It
that
does. It's the
it
cellular.
went to another place.
Yeah.
The so the grade has a lot to do with the way the cells, they call it proliferate, the way that they create, like they stack. So
mhm,
grade A means like it's a slow growth. It's kind of like for Francis being over 60 and over.
mhm,
Typically, like an age is tied to, had in the past been tied to the grade because you were older and you normally had a slow growing cancer due to
mhm,
like, your hormones slowing down and all that other jazz.
mhm,
So when you look at it from A, B, C, D in this category, there are probably some other stuff somewhere else. A is slow growth, B is proliferated, and C is like inflammatory. And
mhm,
it also fits in the same area of triple negatives,
mhm,
and like that's where the HER2s come in too. But no matter what, the ABC that you're asking about versus what she talking about, that's probably something different. But ABC, to my knowledge, is all cellular proliferation and how they stack.
And they
mhm,
do have a
It
grade that'll be 1, 2, and 3.
Yeah.
mhm,
it
They have
is. And
grades in there
Francis,
too.
Francis, so
Uh,
you said that you thought you were stage, I mean, 2A, but they told you were 2B?
Yep.
Yep.
Okay, because yours was in your lymph nodes. See, this is the thing with mine. I was diagnosed with stage 1A, uh, ductal carcinoma.
mhm,
So when my pathology report came back and they did my surgery, she took out 2 lymph nodes to see if it was in my lymph nodes. It was in 1 lymph node. So when I was writing my book, I asked her, I said, do mine change from A to B? And she said, no, yours changed. So I don't know if it's because how many lymph nodes were affected
It
by it,
does.
but
It does.
mine went from ductal carcinoma
Too
in
invasive.
situ to invasive ductal
Yep.
Yeah, the
carcinoma.
same thing
It
I
does.
had.
Yeah.
But my
And
So
letter didn't change.
your letter is the cellular
Yeah,
proliferation. It depends on
right.
how your cells are activating. Your number is how big your tumor is, and
Yeah.
if how many lymph nodes are affected. So
Mm.
I'm like Francis. I actually was riding on the cusp of being stage 3 because my tumor, they couldn't determine if it was 1 or 2, but it was almost 9 centimeters. So that is over 5, which over 5
yeah,
pushes
it was
your
like
level.
Tamika.
And
Mhm.
so, but they couldn't determine if it was 2 that was broken up or if it was 1 big one. So, but again, I'm like Francis, I was B. So that means that me and Francis cells grow quicker than your A. Me,
Mhm.
Francis, I think, and
And that's
Tamika.
exactly
Yeah,
what they
because I
said.
was a two. I was
Even
a
though
two.
it was triple
But
positive,
mhm.
it's an aggressive type.
Correct.
Right.
And then
Mhm.
because Francis
Very.
has the HER2, now
Mhm.
that means that hers is not only associated with the hormonal growth, but she also has an additional hormone that they, saying that's kind of like piggybacks
Yeah, that
and
human
makes
Right.
it more
epidural.
aggressive.
Yep.
Mhm.
But the good thing about the lymph nodes, they never opened up.
Mm.
That was they never, when they took them out, I was
Mhm.
like, that's why I said I didn't know. And then
Mhm.
Maury was like, it was encapsulated. That's
Oh,
what,
fantastic. It was
yeah,
stop. Yep.
and she was like, it was like in the size of a pea, like a bean. It was
Mhm.
plopped into this bean. That's what. So they took out these 2 lymph nodes. I just knew, but it was funny because I went in there. I was like, "Hi, Dr. Sanford. I know I'm stage 2A," and she was. She looked at me. I was like, "I guess I'm not." That's what happens when you read those reports.
Well, I
Mhm.
think it's funny because I think that that ignorance is bliss at times in certain
Yeah,
situations.
but I had to
And
read that report because I wanted to know.
well,
Mhm.
look, I'm not shooting you down at all because I want to read everything. I
Mhm.
don't
Because
like to
I
cry on
went
no
and
more.
I looked
I
up
don't like to
all
cry.
those words in there just to find out. And you know what? When I found out and I understood everything, it was
Mhm.
like 3 years later that I actually understood exactly what it
Mhm.
was.
There's so
You
much
know what?
information.
Yeah,
Yes.
it's hard to understand. So for me, when I first got my first pathology report, I didn't know what anything meant. So, I always got a second and third opinion. I got 2 doctor friends in London. So I send them both a copy and let them know I didn't make any decisions without either one of them. And I said, listen, I want you to treat me like I'm your wife. Eh, would you recommend your wife doing this? Would you recommend her not doing this? And when they both told me the same thing, that's when I did mine because they don't agree with the medicine here in America. They said they love giving y'all drugs and they said we're like surgeon's dreams. My doctor friend just told me this. He said, you got your breast done again. This is your 3rd implant. He's like, I know these surgeons love you. Like he said, they just do anything y'all ask them or pay for.
Mhm.
Mhm.
It's
So
Mhm.
with
crazy.
you having DCIS, what
It didn't stay that way for
you
her.
had your double mastectomy because it was
I
because
just got mine was prophylactic because
okay.
after my lumpectomy, I had my mass was 1.8 centimeters. It was like a little peanut lodged
Mhm.
at the 8 o'clock. And after they did the lumpectomy, I just kept doing my breast exams and everything felt like a lump to me. I was going crazy. I
Okay.
was so paranoid. I waited a year and I couldn't take it anymore. I said, I cannot live like this. Every
Yeah.
time I did one, I just felt lumps. So I just told her I want to just go ahead and remove them. Mine was prophylactic.
Okay.
I didn't have to get that. I would have been fine. She said I could have went on with my life and, took the pill and been okay. But
Mhm.
I didn't want to deal with it. That's the same thing I did with my hysterectomy. I had my first fibroid. It was a tiny little fibroid. It was lodged against my ovary, he said, and it was making my left ovary enlarged. I said, that's a sign of ovarian cancer, enlarged ovary. They said, yeah, it can be, but let's get in there and see. I said, but if you're going to go ahead and take it out, you're going to take everything out because I'm not going to keep coming back to
Mhm.
get this things taken out. I'm just extreme like that.
Mm.
Just take
Yeah.
it out. I don't need it. My daughters are what, 36 and 34? No.
Wow.
Well,
Yeah.
I'm gonna end this, but knowledge is power, but too much knowledge could be dangerous.
Wait. Before you end it, I have an announcement. So Miss Tequila is a board member of Melanin Breast Cancer Alliance, Inc. She have been for a couple months, but we was waiting to share the news so I can put her picture on our platform. But
Welcome to Helen. Welcome.
she is a member along with you, Francis, and Zakara and Chanel, the other women that's on our podcast. And Tamika, she has her own nonprofit,
And
but
Tamika has to tell you
we
about
will be
her event.
collaborating with her in Texas and Georgia. So she's still a part of the family.
She has to tell. She has an event coming up as well Saturday. You can
Yes.
share it here.
That's what's up.
Share
Congratulations.
your event, Tamika. Isn't it this Saturday?
Yes.
Saturday, meet the author, meet the author cancer, what did I call it? Well, excuse me. Meet the, see, that's the brain. That's that chemo
Yeah.
brain. Meet the author cancer
Saying that, what's the
reception.
name of it?
And it's going to be at the 44th and 3rd bookstore in the heart of the West End area here in Atlanta, which is surrounded by Spelman, Morehouse, and Clark College.
Mhm.
Who are
Wow.
the authors?
The authors is, of course, Miss Z,
Yay.
Miss Monique, and Miss Charlisa. And they all have had their own different experience personally with cancer, as well as being caregivers and parents and having parents of cancer.
That's amazing.
So I'm the only
Congratulations,
one that's been
lady.
both?
You know, Miss Charlisa has she's a parent and her parents.
Oh,
One of her parents had cancer, and Miss Monique, both of her parents had different forms of cancer.
okay.
Mm.
So me and her are survivors and caregivers.
Yes, you and Miss Charlisa. Yes, ma'am. Mm-hmm.
Awesome.
Okay, ladies, I see y'all out here.
Amazing.
They out here doing their thing. Andrea,
I
you
see
be
it.
next to be doing something.
I
Oh
see
yeah, I got some things. I got some irons and fires. Yeah.
Well, other than being a board member, what you got going on, young lady?
Who, me?
Did you?
Everything, all the time. Look, my life be oof. I'm trying to get it slow motion. I'm trying to get it to slow down a little bit though now. So yeah, just I homeschool my kids. That's always the
Oh,
whole
okay.
thing in its own
Oh,
self.
right. I was gonna say that's a whole nother
And you
conversation.
got
It's fun
different
though.
grades,
Yeah.
so
It's
okay.
got its little, perks to it, but it's, pretty much just trying to make some transitions in my life. We'll talk. Look, y'all gonna hear about that
Zanab,
on my
I heard you was moving to Africa. That's something that I want to do.
Oh yeah. I'll invite you. I'm not going until July or August. I have to, get through all of this. I wanted to wait until I was over this whole body esteem thing that I was going through. So I'm ready.
You leaving permanently in the summer, or you just
No, I'm
visit?
gonna go there for like 2 or 3 months, come back with my family, and then uh, I'll be planning my relocation while I'm there. But yeah, I'll be going there soon.
Okay.
I've been traveling Africa since 2008, 2000,
Wow.
back and forth. I spent half of my life there, like not half my life, half my time. I would go there for 3 months, come back home for 3 months, back over there for 3 months. I've been doing that for a long time.
Okay, but
Do you have family over
gonna cut
there?
this short because
Okay.
I have a
we can
man
we
over
can we
there.
can we can
Oh.
talk about this when I end it.
Oh, okay, go ahead.
Okay, thank you.
She
Thank
like
you ladies
zip
for
it,
joining
lady.
us. And I will end it. And Tequila, I'm still waiting to hear from you. I did Tamika. Tomorrow I have Brandy. I'm still waiting on Zainab since last year, but that's a different story. Anyway, now that she got her double D, she'll be ready to do her interview.
Okay.
Yes, okay. Thank you for joining us, and we'll be back the second um the second Thursday in March.
Okay.
I will make sure I send you a link. Andrea, if you want to join us, you're more than welcome.
Absolutely.
Okay, I guess I'll get your number from your sister when we hang up.
You can get it from her when she hang up.
Okay, but you don't have to hang up. I'm just gonna
Right.
stop recording.